Welcome, and I am so delighted to welcome you to this first ever inaugural Nutrition and Sickle Cell Conference, hosted by myself, Suzanne Ruggles, CEO and founder of Full Circle Fund Therapies. We are an independent charity based in London and based in England. And today is just an incredibly exciting moment for us to have been able to bring this conference to you. First of all, I would love just to give you a very brief overview about Full Circle and why we exist. Back in 2001, I was invited to set up an integrated medicine project for patients in hematology. At that time, of course, there were also sickle cell patients in the wars, but at that time, there was no provision for them because the funding had been made for cancer patients. So very quickly I realized this didn't feel inequitable. So I made a lot of steps, a lot of red tape, but eventually set up a charity called Full Circle with its aim is to help support patients with life-limiting and life-threatening conditions, children and adults and their carers, and also to extend support to the NHS staff that are caring for those patients. In 2003, I myself went to Harvard to bring back the science of the relaxation response, specifically actually for the sickle cell patient group. Moving forward, we are actually in 2 NHS trusts across this country, but the COVID pandemic forced us to think very differently about what we were doing. So we consulted with patients and our healthcare professional colleagues, and nutrition became a repeated motif. I had a specific consultation process with our sickle cell patients, and it was so loud and clear that this was needed to help the shielded patients cope in a different way to the medical care they're getting, but in a supplementary and supportive way. They were very, very keen to know how nutrition could help support their immune systems. I reached out to my clinical colleagues, that's psychologists, clinicians, clinical nurse specialists responsible for sickle cell, and the feedback from them was unanimous. Yes, let's make this happen. This was supposed to be a workshop for probably no more than about 6 to 10 patients or carers of patients. I reached out, discovered Claudine, was thrilled to discover Claudine, and the rest is about to be shown to be history because this conference we have over 200 delegates. So this is very, very exciting. So from a small beginning, but a heartfelt need, we were able as a small charity to be nimble, to find the experts and to move forward and to bring this conference to you. So I hope you can see I'm really, really excited to be introducing you to the lineup today. So just before we start, what I'd love to do is just a tiny bit of housekeeping. Might take a second, bear with. We're using the Q&A tab for any questions. We will have answers to those questions. They'll be sort of pulled as best as we can after each module, after each section. Bear with us on that. There may be a lot of questions, and we are obviously we've got a lot of content we want to share with you. So after the event for next week, we will go through all the questions, pull them together, put them into a written Word document so that they're there for you. They'll go up on our website. We have a poll going on that will be chaired by Dr. Rebecca Easton, who I'll introduce to you in a moment. This is just to give us a sense of knowledge of the subject as we go through. This is just a brief note just to panelists. When you're not speaking, please remember to turn your cameras and mic off, just of course to avoid any distraction to both the audience and our fantastic speaker who will be on at that time. The webinar is being recorded, as you know, and will be available on demand via our website from tomorrow, which is of course World Sickle Cell Day, and that's intentional. So we wanted to have the proceedings today and then be able to put this up on our website for World Sickle Cell Day. The information will be given to you, but just so that you have it, it's www.fullcirclefund.org. and that will be prominent on our homepage. It will remain there, can be shared whenever, dipped back into whenever, but for you to share with colleagues, your sickle cell patient communities. That is about that on the housekeeping. You'll be very glad to know. We don't have to say exits are to the left and the right and all that stuff. So now it brings me to have the very great pleasure to introduce to you first Dr. Rebecca Easton. Dr. Easton, I was introduced to last year when we were starting this consultation process. And part of what we do with Full Circle is have projects for pediatric medicine as well as adult medicine. And so one of my fantastic psychology colleagues who focuses on adult sickle cell said, you must speak to Dr. Easton. And I'm so glad that they recommended us to speak with her. She has been an incredible source of inspiration, ideas, support, very busy getting her network activated, and I think a lot of you are here from her network, and I'm absolutely thrilled. So just for those of you who don't have the pleasure of knowing Dr. Easton, she is a clinical psychologist. She is working as part of the paediatric psychology service at St George's Hospital in London, which for those of you who may not be familiar with it, perhaps outside of the UK, it's one of the largest hospitals in Europe. And her work sits within the haematology department. Her role is to support children, young people and their families with their physical health, in addition to support schools in understanding the role that they play in supporting young people and families. We approached Rebecca at the start of this consultation process, and it is absolutely a big reason that this is happening today because of her. So there we are. I am privileged to introduce to you Dr. Easton, who's going to lead a short mindfulness session just before the conference begins. So over to you, Dr. Easton. Thank you for joining us.
Thanks, Susie. So welcome everyone today. It's really great to have you with us. What hopefully you should have seen when you join this afternoon is 3 poll questions that pop up. And it would be really helpful if you could just take a few moments. I've seen that some of you have filled them in already, just to answer those questions. We will be repeating them again at the end. It just helps us to get a sense of how useful this conference has been, so that we can think about what we might do in the future, kind of years to come as well. So if you could take the time to do that, we would all really appreciate it. But as Susie said, what I'd like to do now is just kind of lead us in a very brief mindfulness session. So what we're going to do is just start by thinking about our breathing. Hopefully this will allow you to step out of an automatic mode, step out of what else you've been doing today, the other things that you've got on your mind, and give you the opportunity to reconnect with the present moment before Claudine comes to speak to us. So where you are, if you can just get comfortable, whether that be seated, standing. If you want to, please do close your eyes. If you don't feel comfortable, just focus on a spot in front of you. And take a deep breath in. And bring yourself into the present moment. And just notice whatever you're experiencing right now. Notice any sensations, any discomfort, any tension, or any pain, and where that might be in your body. Notice your feet on the ground, or if you're sitting down, notice whatever you might be sitting on. Notice the feeling of the clothes against your body and the air against your skin. And now notice whatever's on your mind. Whatever thoughts are there, and as best as you can, just observe them. Don't try to push them out of your mind, but just notice as they come and as they go. Don't try to change them. Notice whatever emotions you might be feeling, whereabouts in your body you might be feeling them. Don't try to change them, but just notice where they are. And now bring your attention to your breath. Notice the rise and fall of your stomach as you breathe in and as you breathe out. Notice the air flowing through your nose as you inhale and the air as you exhale. Notice it again as you breathe in and breathe out. If you find your mind wandering onto something else, away from your breath, simply bring it back to your breath. Noticing each breath in and each breath out as they follow one after the other. Inhale slowly and deeply through your nose, keeping your shoulders relaxed if possible. Inhaling in, inhaling out. Inhaling in and inhaling out. Inhaling in and one last breath out. Now, as we come to the end, bring your attention back to the room that you're in. Open your eyes if they were closed and notice what you can see and what you can hear. Push your feet back into the ground and have a stretch. Welcome back into the room. So hopefully that's just given us all an opportunity to be present today and to have a focus on what we're here to listen to and who we're here to hear. So I'm going to pass you back over to Susie, who will get us started for the rest of the afternoon. Thanks, Susie.
Thank you very much, Rebecca. That's just wonderful, just what I needed. I don't know about everyone else, but wow, that's just so good and reinforces how important it is just to come back into the sort of present moment and how important the breath is. So yeah, wonderful, thank you. It gives me a very great pleasure to officially commence this fantastic conference on nutrition in sickle cell. The first contribution will be a short video from our consultant of hemoglobinopathies at St George's, who's we're blessed is a very great supporter of what Full Circle does and has done throughout many years. She is also clinical director for specialist medicine at St George's Hospital Foundation Trust. She sadly couldn't be with us today as a very busy consultant. She's taking time away just today and she can't make it, but she is going to be catching up on the video when it's up on our website. But she was very keen to record a small piece from her to voice her support for this conference.
Hello, my name is Lizzie Rhodes and I'm a consultant haematologist who works at St George's Hospital in South London. I've worked there for the last 10 years looking after patients with sickle cell disease, and every week one of my patients will ask me how nutrition can help them, so I know how very important today is to our patients. Over the last 10 years, it's also been an absolute privilege to work alongside the Full Circle team, who have been so dedicated to supporting our patients with the provision of integrated therapies. They make a real difference to our patients, and it's been such a challenging 16 months and they have adapted and to continue to provide that support however they can. The development of today's conference is a testament to their commitment to empowering patients and helping healthcare providers to look after the whole patient. I'm so excited that we have this opportunity to hear from Claudine, a real expert in the nutrition and sickle cell and a real trailblazer in this subject. I thank her for her support of our patients, and I'm looking forward to everything that's discussed and learning lots myself. I'm hopeful that a conference as accessible as today will have a real positive impact, especially when covering a subject so important to our patients. I hope everyone has a good day, and I wish you all a very happy World Sickle Cell Day.
Gosh, that's so heartfelt and so wonderful. And again, I just feel so fortunate that where I was invited to originally set up a project for patients was at St George's, because it has only ever been possible because of incredible people like Dr. Lizzie Rhodes, like Dr. Rebecca Easton, and really 30, 40, 50 other doctors, nurses, physios, etc., who share with us the importance of looking after the whole person. And so now this brings me to have the very great honour of introducing you to Claudine Matthews. As I've touched upon briefly earlier, this conference came about because it was first asked for, not the conference, but the subject of nutrition by our sickle cell patients, seconded by wonderful people like Dr. Easton, wonderful people like Dr. Lizzie Rhodes. So we were given the green light to pursue, to progress. I don't know how it happened, but I was really grateful to have discovered Claudine. Her range of experiences is immense. She's a registered dietitian and a member of the steering committee of the British Dietetic Association for their project Future Dietitian 2025. She's an associate lecturer in nutrition and dietetics. She has expertise in public health and in the area of sickle cell, having authored the first ever national nutrition standards for sickle cell globally, with a range of published articles on the subject as well. She holds a master's degree in healthcare education, health promotion and clinical leadership, and also has expertise in behaviour change techniques, communication skills training, and has extensive knowledge of personal leadership empowerment, coaching, mentoring, and self-development, and has developed a range of personal empowerment frameworks for NHS Trust to be able to begin to access this for the good of their patients. She has been a registered dietitian for more than 13 years with NHS experience in acute clinical dietetics. She is currently completing her PhD aimed at integrating nutrition into sickle cell healthcare provision. We couldn't have asked for a better person to take us through this fantastic conference than Claudine Matthews. So please, I'm going to pass over the microphone, digitally, virtually. The floor is yours, Claudine. Thank you.
Thank you so much, Suzanne, for this amazing introduction. I was moved to tears just then because this has been something that I've dreamed of for the last 3 years, and to finally get to the point to actually have a conference, the first ever conference on nutrition in sickle cell, and being the keynote speaker for the conference is such a privilege and an honor. But before I get to speak, I actually want to introduce you to Dr. Jenny Darkwa, because, as Suzanne mentioned, I'm doing a PhD at the moment in nutrition in sickle cell, but I wouldn't be on that journey if it wasn't for Dr. Jenny Darkwa. And I just want to invite Dr. Jenny Darkwa, if you can turn on your camera at this point, if you're there, so I can introduce you. There you go. Thank you. So just a little bit of information about Dr. Jenny Darkwa. So I'm going to do just read a short bio about her. But then what Dr. Jenny is going to do is she's going to do a short introduction to my talk one. So you will get to hear firsthand from her as well. So Dr. Jenny Darkwa is a GP in City and Hackney. She's the clinical lead and chair for hemoglobinopathies in City and Hackney CCG. She's the clinical director for Shoreditch Park and the City and the City Primary Care Network. But importantly, she's one of my mentors. And she's the reason, as I said, why I've embarked on this doctoral program. So Dr. Jenny, I am so grateful to you for how you've spoken into me and into my life and, you know, this journey that I've gone on. So without further ado, I want to hand over to you as you introduce as you share with us what's on your heart and as you introduce the first talk. Thank you.
Well, thank you, Claudine. Okay, afternoon, everyone. It's really a privilege to be here today. And I'm so pleased that actually we have got to this point, because it has been a real journey for Claudine. As you know, as Claudine has said, for the last 10 years, I've been a clinical lead and chair of the board of haemoglobinopathies in the city in Hackney. And in that role, we've done a lot of work for patients who do have sickle cell anemia, but mainly about making sure that they've been able to kind of access health and care. So my personal experiences with sickle cell anemia stems from having had my eldest daughter about 25 years ago. And at that time, I knew very little about sickle cell disease. And even though prior to becoming a doctor, I had been a nurse, I still knew very little. I knew about the genetics, but never really understood what it was like to live in a household with a child who has sickle cell anemia. By the time my second child with sickle cell anemia was born, I knew a little bit more about sickle cell. And actually, what came to light was how variable the disease is. So one daughter who was very, very ill and another one who actually was fairly well. With this experience of being a GP and a nurse and obviously a mother with a child with children with sickle cell anemia, it led me to attend a steering group which was set up in the city in Hackney prior to setting up the board. And this was the first time that I came across Claudine. So we were sat in this meeting, and there was this self-assured woman who was having a debate by quite a revered consultant at the time. And it was about an issue relating to a patient. And Claudine was adamant that actually her way was right. And I agreed with her. And I remember looking up and thinking, who is this woman? You know, where has she come from? This lady's going to go far. And at that point, I realised that actually she was going to be a worthy advocate for sickle cell disease and patients with sickle cell disease. After that meeting, I went over and I introduced myself. And over the years, we had several meetings. At the time, Claudine was there mainly working on a secondment. But I knew that there'd be a day when actually this Claudine would be in a conference like this, on a world stage, on a platform, advocating for sickle cell patients, because her passion is apparent. So this brings us to the present. Despite the challenges that Claudine has had, she's continued to advocate for patients with sickle cell. She's currently completing a PhD in nutrition and sickle cell disease, and this has not been easy, but she persists. Interestingly though, as a parent with sickle, no one ever addressed the nutritional needs of the children. No one ever gave me any advice or felt it was even necessary. More importantly, as a provider of services to patients with sickle, I've never really had the tools and the knowledge to be able to offer that nutritional advice. So it's something that's been missing in the care of sickle cell anemia for a very long time. I, for one, am looking forward to today's first ever conference in nutrition in sickle cell disease. And I'm going to say that again, because actually this is a milestone. This is the first ever conference on nutrition for patients with sickle cell disease. I'm sure that Claudine's going to enlighten us all today. So let's sit back and enjoy the next few hours as we're transported into the world of nutrition and sickle cell anemia, and who better than Claudine Matthews to take us there. So let me hand over and introduce you to Claudine, who is going to start with her first talk. Thank you.
Thank you so much, Jenny. Much appreciated. Thank you. So as you've noticed with the brochure that was sent out and all the adverts that was sent out about the conference, the title of the conference I chose very specifically, and I wanted to showcase to you the evolution of nutrition in sickle cell through my perspective as a dietitian who was introduced to sickle cell, and I'll say a little bit more about that in my talk. But looking back now to see how far we've come from that very first time that I was introduced to sickle cell to in 2021 being able to lead and be keynote speaker for this first ever conference. So the title of my presentation today is The Evolution of Nutrition in Sickle Cell in the UK, but more specifically, and what I want to leave with you from the start of the presentation, it's a call to action. The presentation and what I will share throughout the conference is, yes, information, but information without action means nothing. So from the first slide that I share with you, I want you to be listening through the lens and hearing through the lens of a call to action. The next slide, please. So what are the learning objectives for the conference? And this would have been shared with you in the brochure as well. So objective 1 is to provide an overview of existing scientific literature about the role of nutrition in sickle cell. And secondly, giving you a different perspective to understand and to consider nutrition and aspects that I share from my doctoral research studies. Objective 2, to recognize the importance of the patient voice. And as Suzanne said earlier on, if it wasn't for the patients asking for nutrition, I'm not sure if this conference would have happened today. Recognizing the patient's voice then in changing the nutrition landscape. Objective to explain the nutritional implications of sickle cell, because I do believe that there are so many people who still don't know the connection between the nutritional implications and the pathophysiology of sickle cell, and then to explain the need to integrate nutrition into sickle cell, which is the aim of my research project. The next slide, please. So I can't continue without first just giving you a very brief overview of what sickle cell is, because there may be people joining us today who is new to sickle cell, and so I'll just do that very briefly. And specifically some of the numbers, particularly in the first section there, is numbers pertaining to the UK. So what is sickle cell? It's a complex, lifelong genetic red blood cell disorder. It is one of the fastest growing genetic disorders in the UK. It affects about 15,000 people in the UK, with about 270 babies born every year with sickle cell in the UK. So what are the main clinical features? The first one I'll highlight is chronic hemolysis. So that is the rapid breakdown of red blood cells. And usually for people who don't have sickle cell, the half-life of red blood cells is 120 days, but for sickle cell patients, that's significantly reduced down to between 16 and 21 days, leading to oxidative stress, chronic anemia and fatigue, and then chronic inflammation. And the second, vaso-occlusion, which is recognized as the hallmark feature of sickle cell. It is the blockage of small and large blood vessels with sickle-shaped red blood cells causing tissue and organ damage over time. There's also impaired immune function because of the malfunctioning of the spleen. And all of these clinical features cumulatively is associated with high levels of morbidity and mortality in sickle cell patients. So brief epidemiology. So sickle cell mainly affects people from African, Afro-Caribbean, Asian, Middle Eastern, and Mediterranean descent. According to the World Health Organization, globally is estimated to have 300,000 babies born with some form of a hemoglobinopathy each year. The next slide, please. So this brings us nicely on to talk 1. And I've titled this specifically a root cause analysis of nutrition in sickle cell. So talking a little bit about my research interest, some context and background. The next slide, please. So who am I? So I was born in South Africa, in Cape Town specifically, during the apartheid regime. And during that time, I experienced firsthand oppression and disempowerment. And these experiences left me with a worldview for social justice advocacy, and empowerment. And so I was qualified as a dietitian in South Africa, but in 2002 gained UK registration, and currently have up to 15 years of experience working as a qualified dietitian in the UK. But at some point in 2014, I was faced with a challenge, and that challenge was the poor knowledge and awareness of the management of nutrition in sickle cell. And as a dietitian, that just rang alarming bells for me, because for me, I felt I had an obligation to make a change and to be that difference for this patient population. The next slide, please. So my awakening to sickle cell happened in 2011, as Dr. Jenny alluded to. This coincided with me actually doing my master's in healthcare education and clinical leadership, and gave me a really good focus point for my master's to really understand the condition and as a public health problem. In 2012, I managed to secure a 12-month secondment as a social liaison officer in sickle cell patients, which actually was extended for 4 years. But this was really helpful because I really got to work with the sickle cell patients, understand the condition, and understand how the pathophysiology actually influences the social care needs of sickle cell patients. But it is in 2014 that I awakened to nutrition in sickle cell. And this came about when I was reading an article about acute trauma as an emerging speciality in dietetics. And all the way reading through, I was thinking about sickle cell as I was reading about the pathophysiology of acute trauma, because I was reminded of the effect of, you know, what was happening in the blood vessels of sickle cell patients when they experience a sickle cell crisis. And that started me to think about, if acute trauma can be considered as an emerging specialty in sickle cell, in nutrition, then why not sickle cell? So in 2014, towards the end of 2014, I wrote my first article about nutrition in sickle cell, which was actually the first article ever to be written, and it was published in the Dietetics Today, our professional magazine, and it made the front cover, and there's an image coming up later so you can have a look. And then in 2015, I did various small research projects just to understand and to scope up the problem, because I didn't know much about sickle cell and nutrition at that point. But then in 2016, as Dr. Jenny alluded to, you know, I said to her that I wanted to do or develop a national nutrition strategy for sickle cell. And she said to me, Claudine, for what you want to do, you have to do a doctorate. And that's how in 2016, I came to enroll onto a professional doctorate. The next slide, please. So my mission has always been and will always be a voice for the voiceless and the marginalized. Empowerment is one of my lenses, my worldview, and one of the lenses that I view and that I listen to people and how I understand things. And also education. So as part of my doctoral research, my theoretical underpinning is based on the work by Paulo Freire, who's a Brazilian educationalist, and his work around the pedagogy of the oppressed. And so education he identifies as a tool for liberation, and that's exactly what I'm aiming to do through my research, using education as a way of liberating, as a way of giving us a new perspective to understand nutrition in sickle cell. And so the mission overall then is to support the integration of nutrition into sickle cell care provision. The next slide, please. So the rationale for nutrition in sickle cell and why I find it really important to integrate nutrition into sickle cell. The next slide, please. So just a bit of context. So what do we already know about sickle cell disease? We know that there are both medical implications and nutritional implications. And currently, sickle cell is managed using a medical model of approach, which means that nutrition is overlooked and is currently not integrated into sickle cell healthcare provision. The next slide, please. So some background. We also know from existing literature that there's a number of nutrition problems in sickle cell, and existing scientific literature focuses on predominantly undernutrition and the nutritional deficiencies as nutritional problems in sickle cell. But unfortunately, despite over 60 years worth of research, not much has changed in policy and practice. And so as I embarked on my research project, I was compelled to take a different route And so that meant that I looked at sickle cell and looked at the complexity of sickle cell, drew on that knowledge, but then also tried to influence and see nutrition through a completely different lens and in a more comprehensive view, other than just looking at undernutrition and the nutritional deficiencies which we commonly know about. And then alongside that, I wanted to also look at what are the many influencing factors affecting the nutrition needs of sickle cell patients. So the overarching problem that I identified was this lack of integration of nutrition into sickle cell health care provision, which was very clearly highlighted in these 4 papers: Prasad 1997, Hyacinth et al. 2010, Khan et al. 2016, and then Miyakun and Hebert in 2019, very explicitly stating that nutrition is not part of sickle cell health care provision. And this is directly, in my opinion, because of this gross lack of translation of the existing scientific literature into meaningful evidence base. The next slide, please. So currently our understanding of nutrition is quite limited, and what I want to highlight with this slide is that yes, we know about the undernutrition, yes, we know about the nutritional deficiency, but what I want people to be thinking about from now onwards is the anemia in sickle cell anemia. We know that sickle cell is an example of a hemolytic anemia, and we know that it's an anemia, but I don't think that we pay enough attention to really understand what the implications are, in terms of nutrition, because we haven't really paid enough attention to the anemia and the consequences of that anemia. So this slide is just drawing your attention to pay attention to the anemia in sickle cell anemia. And essentially, if you look at it, it's the anemia, aspect of sickle cell that actually feeds into the undernutrition and the nutritional deficiencies that we find in our sickle cell patients. The next slide, please. So looking at what are some of the factors increasing the nutritional requirements in sickle cell patients. And so we know already that sickle cell presents a host of complex nutritional problems and complications for patients with sickle cell. These problems are multifaceted in nature due to the pathophysiology and also the fact that sickle cell anemia affects, it's a condition of the red blood cells. And so it affects every organ and system in the body. Nothing is left untouched because it's a blood condition. And there's a wide-ranging clinical manifestations associated with sickle cell disease. And in red, I've highlighted some of those. So there's an increased risk of infection, particularly streptococcal infection. Neutropenia results due to the hydroxyurea as a treatment option for many sickle patients. The inflammatory symptoms that sickle cell patients experience as a consequence of the hemolysis, the chronic hemolysis. Many, particularly the younger children, are affected by stroke, as well as the older people. And then on a longer term basis, you can also have patients experiencing renal failure, liver failure for some patients requiring liver transplantation, cardiac failure due to cardiac iron overload, and chronic lung disease as seen in pulmonary hypertension. The next slide, please. So this slide is actually a slide that the late Dr. Norman Parker shared with me on a presentation he did in the trust where I was working. And again, what he was trying to highlight here is that inflammation is a real problem in sickle cell. And again, this is one of the things that's overlooked when it comes to the nutritional implications of sickle cell patients. And so he highlights in the slide that chronic inflammation is common in patients with sickle cell. Sickle cell is associated with immune problems, which I've identified earlier already. It's associated with iron overload due to the treatment that sickle cell patients have. And then also there's this waste of nutritional resources because of ineffective red cell production, which impacts the general growth and development for many, particularly the younger sickle cell patients. And so inflammation, he says, is an everyday problem, so familiar that it's often overlooked. And I really want to highlight that. It's associated with the production of free radicals, Iron overload causes it, infections causes it, tissue damage due to sickling causes it. And it's also identified that there are a number of sickle patients that have really record levels of inflammatory markers identified in their blood results. The next slide, please. So what are some of the indications in the management of nutrition in sickle cell? So malnutrition, as we've seen, undernutrition is one of those key nutritional problems identified. Poor appetite and weight loss. And then for these patients, oral, enteral, and parenteral nutrition support is indicated depending on the level of malnutrition that's been assessed and identified. Poor wound healing for those with leg ulcers, as I mentioned, stroke, liver transplants, people with renal failure, patients having cholecystectomies, those with infection risk, and then other problems are the gastrointestinal side effects associated with some of the medications sickle cell patients have to take routinely. And in terms of the nutrition, so looking at the micronutrients and the macronutrients, so the macronutrients, looking at the energy requirements and then factoring stress factors, depending on the degree of undernutrition or malnutrition that's been identified. There are increased protein needs for sickle cell patients because of this constant production of new red blood cells. We all know about fluid, that is something that sickle cell patients are referred to or recommended to have regularly. And then you have the micronutrients such as zinc, folic acid, which sickle cell patients take prophylactically, omega-3, selenium, the antioxidants, vitamins A, C, and E, vitamin D, calcium, and then some of the B vitamins. The next slide, please. So what are the proposed mechanisms for undernutrition? And this is in the paper by Hyacinth et al. 2010, and it identifies these four specific mechanisms for the undernutrition. And interestingly, if you look at the first three, increased red cell turnover, protein hypermetabolism, and high cardiac demand and expenditure, this directly speaks to the fact that sickle cell is an anemia. These consequences come directly because of the anemia, the fact that sickle cell is a hemolytic anemia. And then the last point there, the decreased intake possibly due to interleukin-6, which is a cytokinin, and this has been shown to have a role in appetite suppression. The next slide, please. So as you can sense from the slides that I've gone through before, that the current approach that's taken to nutrition in sickle is quite limited. It's quite general. There's limited dietetic input. Nutrition is grossly overlooked as a management option. There's poor referral rates of sickle cell patients to the dietitian. There's lack of nutritional assessment. Nutritional supplements are handed out by by consultants as opposed to dietitians, and the focus is on healthy eating, which doesn't really take into consideration the other factors that have a role to play in the nutrition needs of sickle patients. But looking forward to the future, which is where my research comes in, looking at developing sickle cell specific nutritional standards. And I'm so happy to say that these have already been achieved as part of the 2018 National Clinical Standards for Sickle Cell Patients, available on the Sickle Cell Society website. As part of my research, I'm looking to develop a nutrition management framework for policy and practice development. As part of that, I'm looking to also develop a nutrition management toolkit, nutritional resources, and all of this working collectively to support the integration of nutrition into sickle cell healthcare provision. The next slide, please. So this is very briefly touching on my research, and this is getting us to think about nutrition in a different way. And it's all about developing a whole systems management approach to integrate nutrition into sickle cell disease. The next slide, please. So this is really important and a key point to highlight, that in my opinion, from what I've looked and have understood nutrition in sickle cell over the years that I've been involved in it, is that nutrition in sickle is a health inequality. And it's a health inequality because over 60 years worth of research is available to us, but that research has not been translated into meaningful evidence base. So as we speak today, we don't actually have evidence base to support the policy and practice development in sickle cell cell. That has led to institutional oppression, which means that for sickle cell patients, there's poor nutrition service provision, there's poor access to nutrition services, and it's left sickle cell service users, the patients, the providers, and health planners disempowered. And just very briefly to say that the impact of this collectively is that to date we have poor nutrition knowledge, awareness, poor nutritional resources, and then poor nutrition service provision. And access to service provision and education actually is identified as two wider determinants of health by Whitehead and Dahlgren. So just to bear that in mind. The next slide, please. Nutrition is not part of sickle cell management, and we've seen that in the papers that I've highlighted before. And that is because there's a power imbalance between the medical management and the nutritional management. Although there's a clear rationale for nutrition from a public health perspective in terms of the cost for managing the medical symptomology in sickle cell disease, but also the healthcare burden for sickle cell patients, and the fact that nutrition is overlooked as a management option. And then, as I've just mentioned earlier, the fact that currently we don't have evidence base to support policy and practice development in nutrition in sickle. The next slide, please. So this is a very brief overview of my research project. I may just run through it very briefly or just highlight the purpose because of time. So the aim, as you may have gathered so far, is to integrate nutrition into sickle cell healthcare provision, and it's using a health education intervention. There are two clear objectives. The first one, to identify the barriers affecting the integration of nutrition into sickle cell healthcare provision, and specifically, I'm looking at the optimum nutrition needs of sickle patients. I'm looking at the influencing socio-ecological factors affecting nutrition, and then the recommendations to address those socio-ecological factors. And then the second objective, to co-create and evaluate a nutrition health education framework. And just coming down to the research design and analysis, just to highlight that my participants included both sickle cell service users and carers, as well as service providers and stakeholders. And the methodology I've used specifically was the Learning Alliance methodology, because one of the key principles of that methodology is about the formation of a nutrition alliance. And this is to bring together sickle cell service users, patients, carers, and service providers and stakeholders to actually have a conversation together. And this is the process that we've used to co-design the main output of my research project. The next slide, please. So the research focus, the overarching problem, as I said, the lack of integration of nutrition into sickle cell healthcare provision. And so the knowledge gap that I've identified is that currently there is no framework available to support the integration of nutrition into sickle cell healthcare provision. And the implications of that is what I want to highlight. The impact of that is that there are poor health and well-being outcomes for sickle cell patients, in addition to the medical problems that they experience. The next slide, please. So the next two slides is just two abstracts that I've written based on some of the findings of my research to date. And the first one is a qualitative study to understand the optimum nutrition needs of sickle cell patients and the influencing socio-ecological factors. And in this abstract, I identify some of the findings, and a key finding that's come from both sickle cell service users and providers is this lack of knowledge about nutrition. And just to say in that, so the longer we have a lack of nutrition service provision for sickle cell patients, and sickle cell patients having access to that, that has a direct correlation with the ability for sickle cell patients and providers to actually augment and to learn about nutrition in sickle cell. And then one of the second key findings that I wanted to highlight through this abstract is a personal factor, and it was identified that sickle cell patients, the pediatric patients, sometimes experience depression. And this was quite an astonishing finding for me to hear that, because my experience has always been with adults. And if we can only imagine that, if as an adult we experience depression, what kind of impact that will have on the children. The next slide, please. And the second abstract is a qualitative study to understand the barriers to integrating nutrition into sickle cell healthcare provision. And again, unsurprisingly, we've got a very similar theme to that first abstract, and this is the knowledge of nutrition about sickle, which is suboptimal, again, across both the service users and the providers and stakeholders, nutrition being overlooked as a key barrier, and then the need for nutrition management was also identified as a key barrier. The next slide, please. Right, I know I've had to speed things up a little bit towards the end, but that brings us to the end of talk 1, and I hope that you found that really useful. So now we have a short Q&A session, and Dr. Rebecca Eason, if you can help me identify some of the questions that's come through already.
Hello, yeah, we've got a question from Robert Davies. I'll just read it to you, Claudine.
Yes.
It says, there are some countries perhaps where sickle cell anemia is more prevalent, where there is a greater presence of dietetic input with patients with this disease, or greater input from the dietetic professional body of those countries to promote awareness of nutrition. If yes, what can we learn from them to help us improve dietetic practice in the UK? I'm not sure if you're aware about that.
My understanding is that particularly in the African countries, I'm not aware, certainly in the UK, that we have any sort of policies or practice in place supporting the nutrition management of sickle cell patients. But I think what we can learn from that is that those countries, those people have taken on board, they have listened, and they have made that connection, which I think is lacking in the UK, of the nutritional implications in sickle cell. This was one of the first things that I scoped when I was introduced to this whole idea of lack of knowledge and awareness of nutrition in sickle cell. I wanted to highlight through the work that I did and through the papers that I'd written that there is a direct correlation between the pathophysiology of sickle and nutrition. So I think what we can learn from that is that there's a recognition for that, and I think the biggest thing for me is that, and that's why I started the talk with, there's knowledge and we can know things and there is information out there, but if we don't apply this knowledge, then nothing is changed. And I think my passion and my hope for my doctorate is that at the end of the day, we can have policy and practice change, whereby the changes, in terms of putting in place dedicated services, nutrition services for sickle cell patients, that comes only once we've got policy backing, once we've got practice development backing, and that is the aim, And so I would like to know from the other countries, has that happened? What have they followed? How have they managed to actually do that, if they have done that? And that is certainly something that I would like to do, because that is the aim for me and with my research project, to see in the UK and then widespread that we have policy and practice development so that we can secure and ensure that nutrition service provision is available to all sickle cell patients. I hope that answers the question.
Sounds good. We've got a couple of other ones for you as well, Claudine. So one of them is, how much can dietetic advice and input reduce reliance on blood as part of sickle cell management?
Thank you. That's a really good question. And I think the way that I approach that question is the overall, looking at health and nutrition holistically. And what I was trying to highlight through some of the slides is that the way that we understand nutrition at the moment is quite limited, because we understand nutrition as undernutrition and nutritional deficiencies. But through the research, my research, I will identify that there is a number of other contributing factors that actually have a role to play in the nutritional needs of sickle cell patients. So for anything, for me going forward, I would like for the nutritional management of sickle cell patients to take a holistic approach to how we manage that. And I think if we're able to do that, if we look at the whole person, you know, if we look at, so for my research, I'm taking a socio-ecological model approach, which is looking at the personal, interpersonal, institutional, community and policy level factors. So if we look at all of those factors cumulatively, I think we will definitely have an opportunity to improve the overall nutritional status of sickle cell patients, and down the line, I do believe we will be able to see a reduction in the need, the crisis for some patients, but also the requirement and perhaps even the level, the dosage of the treatment modalities that sickle cell patients require. So I do believe that it will come, but it will come because we will take a holistic approach to how we manage nutrition in sickle cell.
And Claudine, there's just a couple of questions coming in about, I'm not sure if this is something you might go on to talk about in some of your later talks, about what foods are good to eat for better health and for kind of supporting people in managing sickle cell. I'm not sure if you want to answer that now or if that will be a bit later.
That will probably be a bit later, because that will give context. So when I answer those questions later on, it will give a little bit context, and then, you know, I can pick up on that after those sessions. So yes, we can certainly leave that till later. Okay,
I'll save those and bring them back to you at a later time then.
Okay, brilliant. So thank you so much. Really good questions. And I will be taking note of all of the questions as well for myself going forward. But now it brings me on to introduce our next speaker, Mr. Michael Siegby, if I get that pronunciation correct. Michael, do you want to come on screen?
Yes, you got me quite early.
Hi.
You have to give me a second to
all right.
navigate. Give me 1 second.
No worries. So while Michael's doing that, I'll just read and tell you a little bit about Michael. So Michael was diagnosed with hemoglobin SE genotype prenatally. Growing up with the benefit of a pediatric nurse as a mother, he learned to understand the triggers of crises and how to manage his condition and general well-being. In adulthood, Michael has sought to understand more about how sickle cell affects people differently and the various ways the condition can be handled and managed. Michael has a BSc in Financial Economics and an MSc in Real Estate from Cass Business School. He runs a real estate asset management company which focuses on delivering social impact via housing. Michael, thank you and welcome.
Thank you, Claudine, and thank you for your work that you've done on nutrition in sickle cell. I feel I'm quite grateful to have been involved in some of your previous studies.
Thank you.
Thank you. So, yeah, my experience with nutrition in sickle cell is really about using good nutrition to prevent, you know, the things I experience, which is obviously for most people crisis, but for, you know, even things that we probably don't observe. So what I've learned growing up and what I've been taught, especially by my mother, was to obviously, you know, focus on natural foods. But also make sure I'm taking good supplements to just generally keep myself well on a general basis to prevent the likelihood of crisis or anything like that arising. So, for example, in the morning I have a routine. I'll have my breakfast. I'll take a cod liver oil tablet, which, you know, besides the general benefits of cod liver oil, also in regards to inflammation in the body, it has been proven to offset that. I take a garlic supplement. It's just garlic, but fundamentally, again, it's about trying to offset some of the common things that are encountered in the body. And if you ever, as a sickle cell patient, if you ever read your blood test results and you look at some of the metrics which are used, which measure the level of inflammation in the body, such as a white blood cell count, if I'm not mistaken, you can gauge how you are doing, even if you may not be feeling it outright. And from that, you can then assess what you could do just through changes in your diet to potentially offset that impact. And again, look, food is, we consume food every day. It's the principal intake in our bodies. So if we think about how important that is, then it gives us a bit more of a mental weighting as to how much of an impact that will take. Other things is or other things that I regularly take are again kind of driven by my understanding of how sickle cell works and how to kind of mitigate the impacts. So I take ginseng. I've been taking ginseng for probably 10 years now. Again, it's a very clever herb which has been proven to increase the blood flow to the extremities of the body and generally improve circulation. And if we think about, again, one of the major issues or causes of a crisis, which is, especially in winter, which is your blood cells narrowing as a response to cold, for example, this tries to offset that. So there's a lot of kind of science which is not necessarily proven on pure medical grounds, but for me it's just about using logic and common sense and understanding what the benefits of certain foods are and what the causes are of crisis or other complications in relation to sickle cell. And I'd welcome any questions in regards to that.
Thank you, Michael. As Michael said, Michael was actually one of my participants of my research project, and I was very impressed with Michael, during that time, and that's partly why I've asked and invited him to come and speak. But the other reason why I've also invited Michael to come and speak was because of the patient voice. He was very clear in articulating, his need and understanding of nutrition, but also the need for nutrition to be part of the standard management of sickle cell patients. So Michael, thank you so much for that insight. You probably know a little bit more than me, on the nutritional supplement side of things, but thank you so much for your time and thank you for sharing from your perspective. I really appreciate you joining us today. Thank you, Michael.
Thank you, Claudine.
Thank you. Can we have the next slide, please? So the next talk is all about the patient voice, because we couldn't have this conference with me just talking about nutrition and not really spending some time speaking about the patient voice and the power of the patient voice. And as I mentioned, Michael epitomizes the power that's inherent in the patient voice. The next slide, please. So the current nutrition service provision in sickle cell disease, the way I understand it, certainly in the UK, it is characterized by poor knowledge of nutrition. Nutrition is underused, nutrition is under-recognized, it's underdeveloped, there are no nutritional guidelines, and there are no nutritional resources. The next slide, please. And this brings up an important point. We have to listen to the patient's voice. And what I've shared on this slide is just a few phrases of some of the patient providers and service users around nutrition and highlighting the need for nutrition service provision. So one of it is nutrition is fundamental. Nutrition is a massive part of mental health. Nutrition is not part of sickle cell. Nutrition is never mentioned. I have to do my own private research and nutrition is overlooked. And as I said, this is just a few phrases from the multitude of phrases that has come through my research project. The next slide, please. So it's important then that we capture the patient, but also the provider voice. And actually, this article is one that I wrote as a consequence of the findings from the research project last year. And actually, it was written in collaboration with some sickle cell patients providers. And it was written in celebration of World Sickle Cell Day 2020, and this is available on the Sickle Cell Society website. So if you haven't come across this, I will encourage you to go there and have a read and just get an insight from a patient provider perspective and also from a patient perspective. We had a 15-year-old patient called George. We had June, who's an adult with sickle cell patients, and then we had Chloe, who was a pediatric dietitian and who was part of the research project as well. And then I had two year 7 students. So I was invited by my daughter's school to actually come and share about nutrition in sickle cell, and I invited them to write a 100-word summary about their learning from the talk that I gave them, and this was just a summary of the learning of 2 of those students. So if you haven't had a chance to go into the Sickle Cell Society website to have a read, I will encourage you to do so. So it's important to capture the patient as well as the provider voice. The next slide, please. And so very importantly, we have to engage the patient voice to influence change. And at this point, I want to speak directly to the patients and the parents and the carers who are in the audience today. Your voice matters. Your voice matters. I want you to know that. I want you to take that on board. Because your voice matters, you need to use your voice. You need to speak up and you need to ask for what you need. As Suzanne mentioned earlier on, this conference came as a consequence of the sickle cell patients asking for more information and support around nutrition in sickle cell. Use your voice to call out the inequalities in your care. Use your voice to lobby and advocate for change. I've put on the slide the Sickle Cell Society and the UK Forum and the All-Party Parliamentary Group. These are stakeholder organizations that's available to you, that you can tap into, that you can connect with, that you can share your views, that you can contact, and that you can use your voice to lobby, to advocate, to ask for what you need. And so I really want to allow you to take this on board. If you haven't already done that, if you haven't been doing that, if you didn't think that that was needed, if you didn't think that that was important, I want to encourage you today, use your voice. And I was recently reminded about a quote by Maya Angelou that I want to share with you at this point. And the quote is this: stand up straight and realize who you are, that you tower over your circumstances. And by using your voice, you are actually recognizing and taking, recognizing the power that you have within you, standing up for yourself, speaking up for yourself, using your voice to actually bring about the change that you want to see. The next slide, please. And so the power of the patient voice, as I mentioned earlier. This conference will not have happened if it wasn't for those patients using their voice, speaking, asking Susie, about wanting to know more about nutrition. The article that I mentioned earlier on that's available on the Sickle Cell Society website, that article came directly because the participants in my study used their voice to call for more knowledge and information on nutrition in sickle cell. The article below, the pioneering national nutrition standards that I've been invited to write, that came as a direct response to working with sickle cell patients when I was working in a sickle cell service. Directly because those patients voiced their need to want to have nutrition as a management option in sickle cell disease. And then the last bit, the Sickle Cell Nutrition Health Education Framework. Again, that has come because sickle cell patients throughout my research project and those that I've connected over the years, patients, parents, and providers, has come as a direct result of them asking to know more about nutrition, about integrating nutrition into sickle cell. And this framework will provide that opportunity for that to happen successfully. The next slide, please. So I hope you've inspired to use your voice. I know that was a short presentation, but I hope you've been inspired to use your voice like Michael did, like the other participants did, like the patients did when they asked Suzanne. So I speak directly to the patients, I speak directly to your parents, to the carers. Use your voice. and tap into those stakeholder organizations and ask for what you need so that you can play a part in influencing the change to the nutrition landscape in sickle cell disease. So this brings us nicely onto the next Q&A session. And I think after this Q&A session, we will have a short comfort break where you can stretch your legs, and we will resume after that. So thank you, Rebecca.
So we've had lots of different questions come through, Claudine. There's lots of themes about people asking about service provision. How can they lobby for support for dietetic input in sickle cell services? Is that something that you would recommend should be, a dietitian included as part of a normal person that a family member or a child might see as part of their healthcare team? One of the first questions.
Yes, that is what my research is about. That's exactly why the aim of my research is to integrate nutrition into sickle cell healthcare provision. But that can only happen when we are able to influence policy and practice change. And that's why this second talk was so critical. From a patient patient perspective, it's more powerful. I mean, I've been trying to do this for a number of years and I haven't succeeded yet. But if the patients collectively, where they find themselves, within your trust, within your services, if you use your voice, and as I mentioned in the slides before, we've got the Sickle Cell Society there that's representing sickle cell patients. They are there. Use your voice, contact them, speak and ask for support and for them to lobby at a sort of political level and a parliament level for that change to be put in place. I've mentioned the all-party parliamentary group. That again is a platform that is available and should be available to the sickle cell service users, but also the providers as a platform to ask for nutrition service provision to be considered, even for nutrition to be put on the agenda, which is something that I've asked before. It hasn't yet happened, but I remain hopeful that one day nutrition will actually be put on the agenda of the all-party parliamentary group. But it comes with collectively the sickle cell patients, the providers, collectively asking for that. And it takes conferences like this where we actually raise the awareness of nutrition in sickle cell, and really calling out the health inequality associated around that, because that isn't something that I've come across before. This is something that, has come through as part of my doctorate to really understand what is driving the for nutrition not being acknowledged as a management option in sickle. And for me, it is because nutrition in sickle is a health inequality. It comes down to the fact that we haven't translated existing scientific literature into evidence base. So we know research, the purpose of research is to be able to have the evidence base that we can go and we can use to lobby change. And I'm hoping that through the research project, but in collaboration with the sickle cell patients, where they find themselves, ask for what you need. Contact the Sickle Cell Society, contact the UK Forum, contact the all-party parliamentary group, reach out to me, and collectively, if we work together, then we can make a difference. And that is one of the aims of this conference, that we can call out the health inequality, that we can call out the need for nutrition to be integrated, but that we recognize that that can't happen without policy change, that can't happen without practice change. I do believe we are very close to getting nutrition service provision, or even nutrition on the agenda, or on a national level, on a all-party parliamentary. We're very close to that, and so through the conference, and if I can say, that's why I started this. The title of the presentation is about the evolution of nutrition, but it's a call to action. Each one of us on the call today, we are called to action. We are called to be a voice. We are called to speak on behalf of the voiceless. We are called to call out the health inequality and ask for nutrition to be acknowledged as a viable management option for sickle cell. I hope that answers the question.
I think it does, and I think you're touching on you're touching on something that other people have been asking as well, leading to a different question, you know, the relationship between food poverty and the impact of managing nutrition in sickle cell. So I think you've kind of already alluded to that and nodded to it. I'm not sure if there's anything else you want to say about that.
Yeah, I mean, that is a real problem. And that's why it was so important for me to, you know, look at nutrition through a comprehensive lens. Because for years, and I think that's also partly why nutrition hasn't got the traction as a viable option, is because we've limited the way we look and understand nutrition in sickle cell to undernutrition and to nutrition deficiencies. But actually there's so many factors that actually come to bear that have a role to play in the nutrition needs of sickle cell patients. And one of those has come through very clearly in my research is this whole idea of the socioeconomic status and the socioeconomic conditions for many of our sickle cell patients, you know, in terms of having the funds, in terms of having, you know, the ability to buy food that will help to improve, you know, on their nutritional status. But again, I want to stress that's but one factor. That's but one factor. There are so many other factors that can actually come to bear. And I think that when we look at, and that's certainly my approach, and what I want to achieve through the research is that we get people to understand nutrition as a wider, you know, problem than just the food side of things. And I think that if we are able to do that, you know, then we have more leverage, I would imagine, to call for action on a policy level and on a practice level for nutrition to be considered as a management option. And so, yes, you know, nutrition, food insecurity is a major problem because we do have many sickle cell patients. I worked as a social liaison officer for 4 years. I worked with those patients. You know, I went to the service center with patients, you know, to support them. So I recognize that. But I want to say that, you know, for the change that we want to see, where we can have dietitians as part of service provision, where we can have dedicated, you know, nutrition service provision for sickle cell patients wherever, you know, not just in your high prevalence areas, wherever, not only in the UK and not only in those countries that was mentioned before where we have already dietetics in place, but in those other countries, in the US, in Europe, where nutrition isn't seen as a viable option. You know, if we do the work and if we work collectively, and if we understand nutrition through a comprehensive lens, then I think we will be able to achieve that. And yeah, we have to acknowledge, we can't ignore the fact that for many sickle patients, money and finances is a problem. And I hope that through the research, I will be able to provide some useful guidance around how we can address that going forward, so that patients can actually be empowered to feel that they are in a position to do that, and provide for the nutrition needs that they have.
And it's really helpful you're talking about some guidance, because actually there's been quite a few questions about how to lobby GPs, you know, if GPs don't follow advice of consultants, you know, recommending a dietitian because they see people, not my words, but the person who's written the question, as fat. Is there any kind of support or you know, evidence that you might be able to recommend that people draw upon?
All I can say, and it's just repeating, I guess, what I've said before, until we get to integrate nutrition into sickle cell, and until we get nutrition recognized as a viable management option, until we get policy and practice development, until on a national level, we get nutrition placed on the agenda for discussion, you know, we are going to have these accounts. We are going to have where the consultant has said, and nothing's happened in primary care, or in primary care, something has happened and nothing has happened on the other side. And so I think, you know, certainly my passion and my vision for this going forward is that, you know, we have to work towards having dedicated nutrition service provision available to sickle cell as part of the standard management. I want to bring into play just now, if I can, and this is one of the key findings that's come through my research project, is this whole idea of consultants, sickle cell consultants being pro-nutrition. And consultants, because they play such an important role in the management of sickle cell patients. You know, if we can have more if we can have more sickle consultants sort of recognizing the role of nutrition, that the role nutrition can play as part of the management alongside, not to replace. Nutrition is always augmenting the medical management. And I think that's a big problem, that, you know, nutrition, there's a misunderstanding that nutrition, it's either or. It's not either or. Nutrition is an adjunct. Just like if you have, you know, cancer diagnosis, you will have surgery, but you can have as an adjunct treatment to your cancer. It's the same thing in sickle cell, where you have your medical management of sickle cell, but you can have, you've got psychology being, you know, for you, psychology being, you know, an adjunct treatment, you know, you've got social side of things, but why not nutrition? Nutrition becomes an adjunct, you know, management strategy to support how well the medical management can work. And so I really want to, at this point, you know, because what I don't want is for there to be this to and fro and pointing fingers. We have to work together. You know, we have to work collectively. And so I want to speak, you know, to the powers of be in the nutrition management world. And that is, you know, the consultants, they have a big role to play in this as well. Just like I've spoken to the patients to use their voice and ask for what they need, I do believe that the consultants, you have a responsibility and a role to play. That's why I'm doing what I'm doing as a dietitian, you know, one of the only dietitians, but I'm doing this because I do believe I have an obligation. How can I know that there's a nutritional problem in sickle cell and not do anything about it? And so I think we all have a role to play. And if we work collectively rather than working against one another, we can get nutrition on the right agenda at Parliament level, all party parliamentary group, and see that change that we need to see. Not for us, but for the patients. You know, all of this is all about, you know, for the patient's benefit, so that we can see improvements for patients in terms of just the question we had before, that food insecurity, providing the guidance for that on an ongoing basis, but also in terms of improving their health and well-being outcomes as well, going, you know, long-term going forward. And then to reduce that high level of morbidity and mortality that's associated with sickle cell. So we all need to work together. And if we all work together, I do believe, you know, we can be the difference. As I said in the brochure, we can be the difference, you know, that makes a difference, but we all have a responsibility and a role to play to do that.
Yeah, I think that's a really key part, us all working together as well, isn't it? It's really important. Claudine, there's lots of questions coming through about kind of asking about what food advice, any herbal recommendations. I'm not sure if that's something that you want. I know that's thinking a little bit more about your next talk. I'm not sure if you want to save those.
Yeah, I will just say something very briefly around that, because that was something that came through very clearly from the participants, you know, in my research project. You know, all good and well speaking about the socio-ecological factors and all of that, but at the bottom line was that came through very clearly is just tell us what to eat. Just tell us what to eat. And I guess that's the feeling, and that's the questions that come through. I don't have all the answers to just tell us what to eat. You know, and specifically in terms of the herbs and the supplements, because that's not my area of expertise. But I do know that there are people with that kind of level of expertise. And through this conference and through the research and the framework that I will put together, you know, it's important to tap into the experts. So I'm an expert, you know, in one particular area, like you are in psychology. And so part of what I will put out in the end is to get the people who are experts in that area to come together and provide the information that the patients want. Because I would love to, at the end of the day, to be able to say to sickle cell patients, eat this and this and this and this and this and this. And hopefully we can do that to a certain degree. And the next talk will touch on that to a certain degree. But I really would love the sickle cell patients to also sort of understand that, you know, in order for you to get that ongoing support in terms of nutrition, that ongoing access to a dietitian or the experts around, you know, helping you manage your nutrition needs, we actually have to have dedicated service provision, and we actually have to understand nutrition in its entirety. You know, yes, food plays a really important role in the management, but food is just one part of that management. I want the patients to understand, and I, hopefully through my research findings, which I can't wait to share with the world, I can't just yet, but I want them to see, you know, that there are other factors. It's the personal factors, the depression that was mentioned, you know, in the abstract before for children. You know, I was shocked. I didn't know that, you know, depression for young children with sickle cell and the impact that has, you know, and so I want yes, we need to speak about the nutrition, and yes, part of my research project and the management toolkit that I'm putting together is to actually put together a tailored Eat Well guide, and I'll touch on that a little bit later on. But I want you just to understand that nutrition, and if we're going to really get the leverage going forward, we have to see nutrition in a comprehensive way. That yes, it's about food, but it's about those other things that we also need in place in order for us and for you to be in a position to have access to the nutrition services that you need to support your nutrition needs. If that yeah, just, it's not the answer you want, but I want to highlight that because I think that's really, really critical for patients, and that's part of all of us, you know, seeing nutrition in a different way, and the next talk is all about reframing nutrition. So yeah.
So I think there might be lots of questions after the next talk. So I think I know we said we'd have a bit of a toilet break. I wonder if now's a good time to do that for if we say 5 minutes, and if we come back at 3:05. And then we'll get into Claudine's next talk, which I know there will be lots of questions. There seems to be a lot of excitement about that. So we're going to hit pause for 5 minutes and come back at 3:05 for everyone at home.
Rebecca, thank you for those questions as well. Thank you.
Okay, so I hope everyone's had a chance to go to loo if you need to, or grab a drink. I'm going to invite Claudine back, and we're going to continue with what we've been talking about.
Thank you so much, Rebecca. What I will say at this point is thank you so much for all the questions that's come through. It's really amazing just having a quick scan of the questions. I may not be able to answer all of your questions today, but as Suzanne said in the beginning, we will be going through each and every question and hopefully put together answers and make that available through the website, through the Full Circle Fund website. But just thank you so much for the questions. It's amazing. But what I'd like to do at this point is to bring on our next speaker, who's actually Michael's mum. And she is Regina Siagbi. Regina, are you there? Can you turn on your camera? There you go. There you go. Welcome. Thank you so much for being part of today's conference. So just a little bit about Regina. Regina is a lecturer delivering the foundation degree in early years with Kingston University. Her background is teaching, nursing, and psychology. So Regina, the floor is yours, and thank you so much for agreeing to be part of the conference today.
Thank you, Claudine. Good afternoon, everyone. As you already heard, my name is Regina. I'm Michael's mom. It's a pleasure for me to be invited to this forum to speak about the evolution of nutrition in sickle cell disease in the UK. And I also thank all the people who have given me the opportunity to contribute to the event. My talk is not going to be a lecture about sickle cell disease, but I'm just going to share with you my personal experience as a mother who raised 4 children, and 2 of them have sickle cell hemoglobin SC, which is the variant or the mild form. They are now adults living a fulfilling life despite having the disease, as Michael has already said. Today's event is about understanding the importance of sickle cell disease. Nutrition, as already said, a lot have been said by Claudine. I look at nutrition, and according to the Oxford Dictionary definition, is how food affects the body, because food is comprised of a lot of macronutrients, including protein, carbohydrates, and fats that not only offer calories to keep the body functioning, but it also gives energy and also plays specific roles in maintaining our health as an individual. That's of Oxford Languages in 2021. So any human being who does not eat a balanced diet can develop health problems. So people who suffer from sickle cell disease are not different. The only difference is that because of their condition, they need to pay more attention to the diet to live a healthy life. So diet and exercise play a huge role in everyone's life, especially as we grow older. So my upbringing influenced how I feed my children, because my mother always added green vegetables to everything she cooked for us as I was growing, being brought up in Africa. When I had my children, and I knew that because they were the older ones, the first two, I introduced them to diets that are healthy with green vegetables. We eat a lot of fish, including sardines, salmon, fresh fish, dry fish, and eggs. Sometimes even when I make egg sandwich, I mix it with spinach and give it to them, and they also eat nuts. So people in this country say that children do not eat fruits and vegetables, but it depends on what you do from the beginning. So when I started them from a very young age, introducing them to those things that will make them healthy, they never rejected any food or vegetables that I offered them. I also used my own knowledge and background of study with psychology. I did my first degree in psychology, and I studied sickle cell. And also, when I did my master's, I look at was a health psychology in master's. So I actually look at the inequality in the treatment of sickle cell disease. And that these studies gave me a broad idea how to handle my children with sickle cell disease. And also working in a pediatric unit, looking after children who were having sickle cell disease. Also, those helped me to have the knowledge to know that, okay, this is what I had to do with my children to live a healthy life. So I always ensure that they were always hydrated. They were taught how to drink water, avoiding fizzy drinks as much as possible. Children will sometimes ask for those kind of things, but occasionally they will have some. I gave them multivitamins from the time they were babies, and they had good appetite for food. Because they had appetite, they ate well everything that you gave them. And as they grow older, they began to take the supplements like omega-3, in addition to the folic acid, which I know most parents know is recommended for them by the doctors. But as time passed, the pediatricians looking after them stopped the folic acid until they grew up, as they did not need it any longer because their good health was good. So that aspect of making sure that I feed them with healthy food, balanced food, really helped their development. And the doctors realized that there was no need for them to continue having folic acid. Some people come up with the idea that when people suffer from sickle cell, they cannot exercise. But my children did all sorts of exercises. They started swimming at the age of 5. They were involved with all sorts of sports in school. They played rugby, Michael was one of them, athletics and football. And these exercises have become part of their adult life. In my career, I met people who have sickle cell, but were sports women. So if we are talking about nutrition, we can isolate sports. Regular exercises can also help with the diet and nutrition that you put into your body. I remember when they were little, the first time that both of them were on admission as children, on discharge, the consultant was insisting that they should, one of them should be given blood transfusion because we had a little lump on his foot and he went to theater. But with me working on that ward, I said to him, no, I'm not going to let my child have blood transfusion because I knew that if he had that blood transfusion, then it will be something that is going to be regularly given to him and will be part of his life. So I refused. He was forcing, but I was lucky that the pediatrician who was called Dr. Rosita, by then I was working at North Middlesex Hospital, said to me that, Regina, I back you 100% because I know you will look after them. And I said, Dr. Rosita, I'll give them grains. And he was laughing. They never had blood transfusion in their life up to date. So I just want to encourage everyone listening to me as a parent or as a sufferer that it's not too late to change your diet. Regular exercises are also important and you will be able to you see the benefit of what you are doing. Thank you all for listening.
Thank you so much. It's such a privilege to have you, Regina, and those wise words of wisdom for sharing that and speaking to the sickle cell patients today. So I think that sets me really nicely up to go on to talk 3. As I said, I know there's lots of questions in the chat, and thank you so much for all of that engagement. Hopefully you'll get some more useful information from talk 3. Maybe some I'll be able to answer some of the questions. But here we go with talk 3, and talk 3, as I've mentioned earlier, is all about getting us to reframe nutrition in sickle cell and to adopt a new perspective of how we understand the nutrition needs of sickle cell, away from just the way that the literature, the current literature, almost what's the word, it explains nutrition in sickle cell to be about undernutrition and nutrient deficiency, but that from what I've spoken earlier, that nutrition is so much more than simply that aspect of it. The next slide, please. So I can't do this talk without actually looking at the implications of nutrition service provision gaps in sickle cell. And I was just looking through some of the questions that came through. And I think this will answer some of the questions that people had. And so one of the key gaps as a consequence of not having, or problems as a consequence of not having nutrition service provision available standardly for sickle cell patients is a compromised health. So many sickle cell patients potentially have more frequent painful crises, because their nutrition status may not be in the best state. They may not be in an optimal state. And so because they don't have access to nutrition service provision and access to a dietitian, or at least sort of information, that can give advice around that. There's increased risk of sickle-related complications as a consequence of having frequent painful crises, because we know that the crisis results in tissue damage and organ damage. There's an increased risk of morbidity when we don't have sickle patients having access to nutrition service provision. And then overall, there's a poor quality of life. And we also know that for many sickle cell patients, that there's a disability associated with the symptomology of how they experience their sickle cell disease. And so, we have to pay attention that if we don't provide nutrition service provision to sickle cell patients as part of their standard management, then that will have an impact on their overall health and well-being. So potentially there's an increased financial burden on the NHS, and this comes through the high readmission rates in sickle cell disease, particularly around painful crisis and sickle cell patients needing to be admitted into hospital to manage their sickle their crisis through a hospital admission. We know that the cost to managing the symptomology in sickle cell is quite, there's a high cost involvement to the NHS and to the services that provide care for sickle cell patients. And I think one thing I want to highlight here as well, and this might not seem like a big cost, but every little helps, as they say. And so currently, because we don't have nutrition service provision available as part of all sickle cell services, we have sickle consultants actually managing the nutritional problems of sickle patients instead of dietitians. And if you look at the cost factor for that, it's more expensive for a sickle cell consultant to do that than to actually refer that patient to a dietitian, and for the dietitian to do the nutritional assessment and then make their recommendations accordingly. And so another factor to highlight as a gap due to a lack of nutrition service provision is the poor quality of care, and specifically around nutrition service provision. And so to date, what we have in the UK, and I would think around the world, is that there's no standardized approach to nutritional care provided. And I think that is a real problem. And that is partly why I felt compelled to write the National Nutrition Standards for sickle cell, because at least that was giving guidance to sickle cell services, around the nutrition management of sickle cell patients, and that is, being able to have sickle cell patients referred to a dietitian, having sickle cell patients having a formal nutritional assessment from a qualified dietitian, using the MUST tool that is available, not just for sickle cell patients, but for everybody, and also then getting dietitians to be part of the NDT that usually manages the medical side of sickle cell patients. And I think that is a real oversight, in terms of how sickle patients are managed at the moment. And the standards clearly call for dietitians to be part of the MDT. As I mentioned earlier, we already, as part of the normal clinical management of sickle cell patients, we have obviously the medical side of things. We have the consultants and the doctors. We've also got psychology, and we've seen Dr. Rebecca in her capacity. We've also got social care officers being part of providing care for sickle patients, but we don't have dietitians. And we know from the beginning, the slide that I shared with you, that sickle cell actually has both medical and nutritional implications. And it just doesn't make sense to me that we can have all those other healthcare professionals as part of the management of sickle cell patients, but that we can't actually have dietitians or nutrition recognized as a bona fide management option for sickle cell patients. And that is where the nutrition in sickle cell, the health inequality, comes in for sickle patients, in terms of accessing nutritional service provision. It does come down to money, and it does come down to the finances. So I recognize that. But we know for a fact, through the research that's out there already, that there is a clear direct correlation between the pathophysiology and the nutritional implications of sickle cell disease. And so for me, that is a health inequality that needs to be called out, and that certainly needs to be addressed, so that all sickle cell patients, wherever they find themselves, high prevalence areas as well as low prevalence areas, can actually have access to nutrition service provision. And so we also know from the slides that I've shared earlier on that we have limited evidence base to support service provision and treatment, from a dietitian. So, I've been talking about getting dietitians involved, and I'm very aware that when I did my study in 2015, looking at the knowledge and involvement of dietitians in sickle cell, and this was way back in 2015, so 6 years ago, it was clear that the dietitians don't know about sickle cell. And if you don't know about sickle cell, the condition, then it's very difficult for you to actually tailor, the support and the guidance and the treatment that you eventually give to sickle cell patients. And so we do need the evidence base, but we also need to be able to educate the dietitians who, we bring into the service provision around what sickle cell is and the nutritional implications of sickle cell, if we are to provide safe and high quality care. And so part of the output of my research project, the framework that I've been speaking about already, is to provide that level of knowledge that can inform both dietitians and clinicians and the sickle cell patients, their carers, their parents, about that, the nutritional implications of sickle cell, and then strategies as to how they can safely and effectively manage that for sickle cell patients. And so, yes, we do have a lack of involvement of dietitians as a consequence of that. And hopefully going forward, that will change as we start talking about sickle cell and nutrition a bit more, within our various organizations, and as we reach out to the organizations such as the Sickle Cell Society, the UK Forum, and as I mentioned, the All-Party Parliamentary Group, to get nutrition placed on the agenda so that we can have the conversations and try and improve service provision or access to nutrition service provision for sickle cell patients. The next slide, please. So this is actually a paper that I wrote in 2015 about sickle cell disease being a multifactorial phenomenon. And it just supports what I've been trying to say, in the sense that, we have to see and understand nutrition in sickle cell through a much wider lens and through a more comprehensive lens. And this is what the aim of that paper was about. And, what the paper sort of draws attention to is that it's essential to consider all the factors affecting the nutritional assessment and the nutritional risk of sickle cell patients. And that includes, yes, importantly, we have to look at the nutritional considerations of sickle cell patients. We have to look at the food side of things. We have to look at the food insecurity side of things. But we also have to look at the frailty, for many sickle cell patients. And I know when you use the word frailty, you're thinking about older people, because that initially, when I used the word frailty in the context of sickle cell, I was frowned upon because, they're young. It's young people in hospital, but these are young people, and for many of them waiting to have hip replacements, which means that they become frail, because of the sickle cell, they're isolated, and so they don't go out, and that has a role to play on their ability to eat, their appetite, going out to get food. And so, in terms of nutrition, and that's why I say it's not just about food, it's about understanding the other factors that have a direct bearing on the nutritional needs of sickle cell patients. And then, as I mentioned earlier, the gastrointestinal side effects of just look at the pain relief. So many of sickle cell patients, when they have their pain relief prescribed, alongside the prescription of the analgesia or the pain relief, they have to have antihistamines, they have to have laxatives, because those are the side effects. So for some patients, it's nausea, it's vomiting. And so, it's those things, they have direct nutritional connotations and implications for sickle cell patients. And so yes, so when we speaking about the nutritional considerations in sickle cell, it is much wider than food, but I do recognize, and I want to acknowledge that, that is an important part for sickle patients, because that's the control that you have as a sickle cell patient. You can control, what you go to the shop, what you buy, what you order, and all of that kind of things. And I really want to be able to be in a position where I can, provide you with that information medication, so that you do have that level of control in terms of the food that you buy, the food that you choose. Just like Regina said, you know, she was able to prevent Michael from having, or one of the children from having blood transfusions, because she was paying attention to the type of food she was feeding her children. And so yes, food, you know, specific foods has a role to play, but we do need to factor in those other factors as well. And certainly the side effects of the medication that sickle cell patients have to take. I mentioned earlier about the neutropenia. So that is a side effect of patients being on hydroxyurea, you know, depending on the dose that you are on. And so that can have another sort of nutritional implication in terms of your immunity and your risk for infection. And we know that infections can increase a patient's risk for malnutrition and poor intake and so forth. And so yes, you know, we have to consider the nutritional considerations, but you know, in a wider context. Then we also need to look at the medical considerations, and I've sort of touched on some of those medical considerations. I mentioned about the analgesia, or the pain relief that sickle cell patients have to have, and then the side effects that's associated with that. You know, that is an important factor that we need to bring into the equation when, as dietitians, or even, you know, as clinicians, when we assessing the nutritional needs and the nutritional risk of sickle cell patients. So the medical considerations plays an important role as well. And then the psychosocial factors, you know, for any person living with a long-term condition, that, you know, for many patients, that can definitely have an impact on your, you know, anxiety around that, depression for some patients, you know, having to live with a long-term condition that's incurable, so to speak. Obviously, there's research happening around that at the moment, but, you know, for many sickle patients, you know, they have to live with the symptomology, with pain on an ongoing basis. Many patients have chronic pain, and that has an impact on, you know, how they see themselves, how they feel about themselves. You know, it has an impact on isolation. It has an impact on, you know, how you interact, your relationships with other people, and all of those things can have a negative impact on your ability to eat, you know, ability to choose the right kinds of food, depending. For some people, it may be that they go off food completely, you know, that they don't want to eat because they just feel low, and they're not motivated, and they just, you know, don't think, you know, yeah, food is important, you know, they've gone off their food. But for others, it may be the other way. And so we have to, you know, look at both of the spectrums, but bearing in mind that the psychosocial factors has a key role to play for many patients. And it came through, you know, in the feedback, in the findings from the participants that I had as part of my research. It was really clear, you know, that mood played an important role in the, you know, patients feeling, you know, wanting to eat or not wanting to eat, and also what types of food, you know, wanting to cook or not wanting to cook, you know, and then opting for taking takeaways instead of cooking for themselves. You know, and one of the things that was shared as well that came through was, you know, just being able to open up a container. If you're in pain, you know, and you can't actually open up a container, you know, for food, that has implications as well. And so therefore, you know, it's important that we look at the psychosocial factors as well, because that has a direct bearing on the nutritional needs of sickle cell patients. And then the wider determinants of health, and I've mentioned earlier on in talk one, the fact that, you know, sickle patients don't have access to nutrition service provision. Access to health services is a key wider determinant of health. Education, knowledge around sickle cell, that was a common theme that came out. You know, the disempowerment for both sickle service users, service providers, health planners was a key part, you know. And then unemployment, again, bringing that closer, you know, to the question that came up earlier about food insecurity, you know, in terms of food availability, but also in terms of affordability. You know, all of those things, you know, has a role to play, and that we need to factor in, you know, when we are assessing the nutritional needs of sickle cell patients, and also the risks nutritional risks of sickle cell patients. And this article was sort of just highlighting, you know, those key things that we need to bear in mind, you know, which makes sickle cell very complex and certainly a multifactorial phenomenon. And if you look at the figure on this slide, nutrition in sickle cell, the top circle there, it says nutrition is more than healthy eating. You know, when I've been to nutrition or conference, sickle conference before, and I've spoken about nutrition, you know, the question I kept being asked was, it's just healthy eating, it's just healthy eating. And it's not just healthy eating, as I've been explaining to you. There's so many other factors that need to be considered. And so, yes, it is more than healthy eating. It is more than nutritional supplements. Yes, nutritional supplements has a role to play, particularly for the patients with poor appetites, with weight loss, who are experiencing malnutrition. And that's just one aspect. But it's not the end all of the end all of the problem. And then we have to take a holistic approach to nutrition, as I've been saying before, and it all boils down to the aim of my research, you know, which we all need to be working towards, is getting nutrition integrated as part of sickle cell care provision. The next slide, please. And so that's why I have taken a health promotion approach to my research project, because what I found with health promotion is, and the key principle of underpinning health promotion, is that it enables people to take control of their life and their health. And that is so important, because remember, one of the lenses, my worldview, is about empowerment. It's about being able to give sickle cell patients control over their health. And I find with health promotion and taking this approach, you know, we will be more able to support patients to take more control of their life and of their health. And what health promotion allows us to do as well is improving the health and well-being outcomes. And we've seen earlier on that because nutrition isn't part of the standard management of sickle cell disease, and it's not integrated into sickle cell, the impact of that is, you know, on poor health and well-being outcomes for sickle cell patients, particularly in the area of nutrition. And so it's really important that we bear that in mind as well, you know, when we're thinking about nutrition, and certainly health promotion, taking a health promotion approach enables me through the project to be able to support and improve the health and well-being outcomes for sickle cell patients moving forward. And what I love about health promotion as well, which is why I titled the first talk a root cause analysis of nutrition in sickle, is that health promotion actually calls us to identify the root causes of ill health. It takes us to take a step back and to understand what is it, what is feeding, why has nutrition not been incorporated or integrated into sickle cell healthcare provision in the past. And by doing that, I've been able to identify nutrition in sickle as a health inequality and look at the institutional oppression that I spoke about earlier on, as well as the disempowerment. And that's because through using a health promotion lens for the research, I've been able to take a step back and really delve down and try and find what are those things that we need to address that is actually going to help move the agenda for nutrition in sickle cell further forward. And then lastly, through taking a health promotion approach, I am able to take a socio-ecological approach to understanding the influencing factors, you know, of nutrition in sickle cell, and take a whole systems approach. And so what the socio-ecological model allows me to do is to look at the personal factors, the interpersonal, the institutional, the community, and the policy level factors that actually come and have a role to play on the nutrition needs of sickle cell patients, but also the barriers to integrating nutrition in sickle cell. And so, you know, taking a health promotion approach is definitely, I think, a way forward. And if you look at the clinical standards for sickle cell, it actually highlights that the fact that nutrition is only seen as an emerging sort of problem in a public health context within sickle cell. And so definitely, you know, we have to start there. And I think health promotion allows us to really take the agenda of nutrition further forward. And then the conceptualization, or the main concepts that I am able to use as part of my research is health education. As I've mentioned earlier on, education is a key determinant of health, and so I really want to address that through this. Health empowerment as well is a key part of you know, the outcome I would imagine from the research of taking a health empowerment approach. And then also the whole idea of personalized care. And personalized care, you know, is something that the NHS is promoting. And, you know, if it's relevant to other conditions, why not relevant to sickle cell, and why not relevant to nutrition and sickle cell? And this is all about placing patients at the center of care planning and provision. And it's giving patients more control and choice over the health. So I do think that that is a really key part that we need to bear in mind as well when we're thinking about, you know, nutrition service provision for sickle cell patients going forward. And then lastly, critical consciousness. And this is literally just being aware of those root causes that has held nutrition back from being considered or integrated into sickle cell healthcare provision. So having an awareness of those problems, but then from that awareness, using that information to actually reflect on and to come up with actions that we can put in place to bring about the change that we want to see, bring about the change in service provision, bring about the change in policy and practice development. So those are the key concepts that that is part and underpinning my research project. The next slide, please. And so again, empowerment, and I want to share this slide because for me, it is so critical to empower and activate the patients. And for me, it's more than raising awareness of nutrition. It's more than, you know, knowledge around nutrition and understanding nutrition. It is actually about empowering the patients to make the decisions and make the right choices that's actually going to support their improvement in their health and well-being outcomes for themselves. And so what I've done is actually I've developed an assess health questionnaire. This is literally just 6 questions that I've put together, and it's looking at the patient's attitudes, you know, around their health, and I use this currently with my other patients, you know, in my role as a dietitian, but it's very relevant to sickle cell patients, and I want to, you know, put this out there so that we can start considering and understanding the importance of empowerment in how we interact with our sickle cell patients moving forward, not just in nutrition, but generally. And so this questionnaire, this health questionnaire, the first question is assessing the attitudes that patients have towards the importance of their health. The second question is around their motivation, you know, to make the changes to improve their health. Third question is about their belief about the ability to make the changes to improve their health. The fourth question around their confidence to be able to make their changes. The fourth, and that speaks directly about empowerment. The fifth question, it's about self-awareness, their awareness of their needs that they have in terms of improving their health and well-being. And then the last question, 6, is all about encouraging the patients to take self-responsibility, but also a chance for them to look at what they're already doing well, because sometimes patients are doing wonderful things that they haven't sort of taken notice of, and through the questionnaire, it gives them an opportunity to hear what they're already doing well, and then to identify the gaps that, you know, that we can provide guidance around. So empowerment to improve health and well-being is really, really important and critical, in my opinion. The next slide, please. The nutritional considerations, and with the next slides, I'm just highlighting that nutrition, and I know sometimes we either work in a pediatric setting or we work in an adult setting, and sometimes you can just be focused on that group of patients, but I want to highlight with the next couple of slides that nutrition is across the life course of a sickle cell patient. The next slide, please. So yeah, nutrition problems occurs across the life course of a sickle cell patient. So certainly within pediatrics, we can have, and we know it's well documented about the delayed growth and development for sickle patients. For some, it's stunting and wasting as the main problems. And this all comes as a consequence of patients having disease-related malnutrition. And I just want to say at this point that disease-related malnutrition, again, if you look at the literature, it isn't a term that's actually used in current literature to explain the type of malnutrition that's experienced by sickle cell patients. It's usually just described as undernutrition. But I want to, going forward, change that. And I have written a publication that's available whereby I highlight disease-related malnutrition as a term that needs to be incorporated in the literature because it also almost emphasizes the nutritional implications as a consequence of the pathophysiology of sickle cell. And so the nutritional problems comes directly as a consequence of the disease, of the symptoms and symptomology of sickle cell. And that's why I'm in favor of using disease-related malnutrition as opposed to just using undernutrition, because it gives that little bit of context as well. And so for adolescents, you know, and again, if you look at the literature, this is the time when many sickle patients, you know, they really struggle because in the early years, the parents would have done a lot of the planning, reminding, you know, take your medication, go through your appointments. And at this point, you know, you're going into secondary school, you teenage years, you want to do your own thing. And so, you know, we know from the literature that during this time, there's this whole idea of delayed puberty and sexual development. There's an increased risk of infection for the adolescents, because for many of them, they don't take their medication, they don't take their penicillin as prescribed. There's nutrient deficiencies, because at this point you go to secondary school and it's all about chicken and chips and the lovely green leafy vegetables. That gets put to the wayside because it's not cool. But obviously the implications of that is, you know, that many of the adolescents in this age group end up developing disease-related malnutrition as a consequence. And then if you move on to adults and aging, so we've already seen that sickle cell and symptomology is associated with an increased risk of morbidity and mortality. And certainly pregnancy opens up, and I saw there was a question around pregnancy as well in the questions. You know, pregnancy, you know, brings up a whole host of nutritional problems, both for the parent, for the mum, but also then for the pregnancy and the health of the pregnancy. And then also when it comes to delivering the baby and the health of the mum and the health of the baby. Frailty, I mentioned earlier, is not just for the elderly. Frailty in sickle cell can be for those younger people who are waiting to have hip replacements. And that's really having a devastating impact on their quality of life and obviously in terms of their disability. And so I've mentioned earlier on as well the gastrointestinal problems that can come as a consequence of the side effects of the medication that sickle cell patients have to take, particularly in terms of the pain relief and some of the treatment modalities that they have to have. The next slide, please. So what are the main nutritional problems that's been identified in the existing literature? And so we have high resting energy expenditure. You know, if you've done self-research, you would have come across this. And this is directly as a consequence of the anemia associated with sickle cell anemia. The rapid breakdown of red blood cells, you know, the high protein turnover as well in terms of making new red blood cells. The poor immunity, we've already mentioned that earlier on as a key clinical feature, because the spleen may not be functioning optimally, which is the case for many sickle cell patients. We have patients with a low BMI as a consequence of the fact that they have these higher energy requirements because they have to work so much harder. The heart has to work so much harder to pump the blood around, and there's obviously hypoxia because of associated with the anemia. That's an ongoing chronic problem for sickle cell patients. Some patients do have poor exercise tolerance, but I want to just go back to what Regina was saying, that Michael was able to play rugby and was able to do exercise. I know for some patients, you know, you may not be in a position to do that because of your level and complexity of your symptoms of sickle cell. But, you know, it's just bearing in mind that, you know, being active, and it doesn't mean playing rugby like Michael was able to do. It means just even going for a walk or just, you know, doing little bits around the house. But yeah, but for some patients, we recognize that that may be a problem. And then appetite suppression. So many patients, and this came through very clearly in my research as well, that pain, you know, pain is one of those things that can knock anybody can knock their appetite and so forth. And so that's something that we have to bear in mind as well for sickle cell patients, particularly, that when they are in pain, you know, food may not be a priority. And I remember speaking to a parent, and she was saying, you know, when her child is ill or has to go to hospital, and particularly because they've had a painful crisis, you know, in terms of food, that's not the priority. The priority in that moment is my child, getting my child better and getting them through the crisis and stuff. And so I think that's a really important point to bear in mind as well, that pain, and particularly, you know, when you're in hospital, you know, that initial period can, you know, have a really big impact on your nutritional needs as a sickle patient. And I mentioned earlier before, the cytokine interleukin 6 can also have an effect of appetite suppression. But what I want to highlight in this slide is that the gap. You know, I've been saying, you know, we have to take a wider and a comprehensive view to the way that we understand nutrition. And so, yeah, so the current scientific literature about nutrition and the main problems is all about those things I've mentioned on top, but it doesn't currently mention about those other factors. And that's the gap in the literature, which hopefully through my research, I will be able to make a significant contribution towards, and that is highlighting the impact of the socio-ecological factors influencing nutrition. The next slide, please. So how to address the common problems experienced by sickle patients, and I've just listed a few key ones that I've come across when, you know, speaking to sickle cell patients and parents over the years. And obviously dehydration is a very common problem for sickle cell patients, and this is actually what you know, it was really clear through the feedback that I got as part of my research, that fluid, unfortunately, fluid actually gets given more priority over nutrition. So that is highlighted and that is promoted, you know, by consultants, physicians, nurses, etc., but not nutrition as a whole. But dehydration, we have to recognize, is a problem, and certainly in terms of as a trigger for crisis. And so, yes, we need to include and have enough fluid in the diet for sickle cell patients. And that in itself, you know, is a problem for many patients. You know, not many people like to drink water and so forth, but it is something that we have to encourage. And so I'm not knocking that, you know, that there's an emphasis on fluid, but it is just taking, you know, it's fluid and it's nutrition. And that's the message that would be great that to come through. Impaired immune function, we've heard about that already, and that obviously has an increased risk of infection, and certainly COVID-19 has highlighted, you know, the immunodeficiency associated with sickle cell disease and the need to boost and build the immune system of sickle cell patients. And as Regina mentioned, and as Michael mentioned as well, the quality of your diet in terms of what you choose to eat, and it is, you know, the green leafy vegetables that you have certainly is the kinds of foods that would contribute to you know, helping to boost the immune system. But it's also because that group of foods will provide the antioxidants that we need to actually counteract the oxidative stress that happens as a consequence of this rapid breakdown of the red blood cells. And so it is important that we pay attention to the different foods that can actually help to improve and boost the immune system of sickle cell patients. And Michael, in his, his experience, shared some supplements that he uses regularly and routinely, and I've seen some questions around that as well in the chat about supplements that can be taken to boost the immune system. So that is a common problem for many sickle cell patients. And then inflammation, as I mentioned earlier, this is something that's not commonly brought out and highlighted as a problem in sickle cell patients. But as the late Dr. Norman Parker illustrated in his slides, it is so common that it's overlooked, but it is a real problem. And so, a basic thing that we can start doing, if you're not already doing that, is to increase your omega-3 fatty acid intake, and this is through either oily fish in the diet, and I've made a little list. So salmon, mackerel, tuna, sardines, plant oils, walnuts, flax seeds, and certainly choosing foods that have been fortified with omega-3s would be your better choice. And for some patients who can't tolerate fish, taking an omega-3 supplement might be just the thing that you need to take to address the inflammation. Chronic anemia and fatigue, a key symptom of sickle cell, and again, the implications this has, in terms of the raised energy expenditure for sickle cell patients. So they're needing to take more carbohydrate-rich foods, more energy-rich foods in the diet, and also factoring in sort of stress factors, to boost the total energy intake that they take through the diet, because they're using so much, as a consequence of the symptomology that they're experiencing. Constipation, again, not something that's commonly spoken about, but that's a real problem for sickle patients as a consequence of the medication that they on the analgesia that they take. And so that, is a real problem for many sickle cell patients that's not spoken about. And so certainly ensuring that you're taking a good fiber intake, going for whole grains in your diet, having your fruits and vegetables can serve for the fiber, but can also serve to provide you with those vitamins and minerals that you need, those antioxidants that you need to boost your immune system. And then water, so the fluid to reduce dehydration, but also the fluid to improve and help with constipation if that is a side effect that you're suffering with. And then that activity, just being active, can also help to improve the constipation. And then those patients with a low BMI, again, is just ensuring that your diet, you're taking in enough calories to meet your nutritional needs, to balance that so you can stay stable and not be in an energy deficit where you're actually losing, or in an energy what's the word where you're taking in more that you need, and that can lead to weight gain. The next slide, please. So yeah, we need to take a holistic approach to nutrition, and the Eat Well guide I've included here because this is sort of the basic healthy eating sort of guidance that's out there. But I will say that I am actually, as part of my research, developing an Eat Well guide based on that, but tailored for sickle cell patients. So look out and watch out for that. That is coming. So again, it can be really specific and tailored to the problems that we've just spoken about for sickle cell patients, and you can use that in your everyday sort of healthy living and food choices. And so, yeah, we're looking at a normal diet, but we're also looking at foods choices that will provide us with the vitamins and minerals we need, the antioxidants that we need, the fiber that I mentioned. But importantly, to highlight as well that many sickle patients follow a vegetarian diet, many sickle patients follow a vegan diet. So being mindful of that, and hopefully through the guidance that I will include, part of the management, I will be able to give specific guidance around that as well. And this is coming to the questions that has come before, and also specific questions around the herbs that's used a lot in African countries, the homeopathics, and also alternative medicines. As I said before, this isn't my area of expertise. I don't, that's not my area of expertise, but I know of people that this is their area of expertise. And so we have to bear in mind that some patients use these alternatives, these supplements. And I know from having read through the literature that there is a lot more research being done to look at the efficacy and also the safety of using herbs and homeopathics and plant-based supplements. And so hopefully we will have the findings of that translated into evidence base that can inform our decision making, and also obviously that so that you as the sickle cell patients will have that information available. And certainly, you know, that information will be updated as we get it and as we move along. The next slide, please. And so in terms of nutritional monitoring and raising awareness, we have to look at red flags, just like we have red flags for other conditions. For nutrition in sickle, the red flags are unintentional weight loss, prolonged appetite and poor appetite and intake that can result in malnutrition, disease-related malnutrition, and then also patients who have worsening or increasing complications and infections, and also patients who have ongoing pain. You know, it may be that there's a nutritional reason underpinning that. And so it's important that we're mindful of taking note of the red flags as a parent, as a clinician, as a consultant, and therefore we have to regularly monitor the nutritional needs of sickle cell patients. And I say at every opportunity, it's at every opportunity, it's at every appointment, and it's at every annual review. And if we don't do that, then we will run the risk of many sickle cell patients actually having, and I've seen this again as a finding of my study, that there's a late diagnosis of nutritional problems for sickle cell patients. One of the participants said that, you know, and she's, you know, over 40, and she was diagnosed with osteoporosis, and she said, why hasn't anybody told her about this before? And she's very conscious about what she eats, but if someone had taken the time to speak to her about nutrition as part of a normal management, who knows, you know, that could have been prevented. And so definitely we have to regularly monitor the nutritional needs of sickle patients. The next slide, please. And so you have to take responsibility. I'm going to just kind of speed up a little bit again at this point, just for time. Yeah, so we all have a responsibility. As patients, you need to understand your condition. You know, many patients I've spoken to, they don't quite understand the symptoms and their condition and why they experience the symptoms that they have. So it's really important that you understand your condition and that you are able to recognize and know what are the nutritional consequences of your condition, that you understand the importance of the early recognition so that you have a role to play in that as well, and understanding the nutritional risk factors, as I've just highlighted in the previous slides, but also then to know what are the main nutritional triggers in terms of your crisis. So that is key things that you can do to help manage and improve on your nutrition and then your health and well-being outcomes. And then for the provider, you know, again, before I could do anything about nutrition in sickle, I had to know and I had to learn sickle cell. And so you do need to know and understand the condition. Otherwise, you can't serve your patients, you know, the way that they deserve to be served. And so you need to know the condition. You need to recognize the nutritional risk of sickle cell patients. You need to call for and ask for mass screening, you know, screen for the malnutrition risk. You need to assess the nutritional risk, and therefore you have to ask questions, and therefore the monitoring is important. Have they lost weight? Do they have a poor appetite? You know, do they have an infection? And ask those questions and then refer on. As Dr. Jenny said in the beginning, you know, she didn't have enough knowledge about that, you know, in terms of supporting the nutrition needs of sickle patients. But if you don't know, then you refer on. And I know, you know, not every service will have access to a dietitian, but that's precisely why we need to create that need, because if we don't create the need, there isn't a need, and people will say, but no one's asking for it. So we need to, you know, refer patients to the dietitian, refer, you know, and from a GP to the dietitian, from the consultant to the dietitian. That has to happen. And then raise awareness amongst your colleagues. You know, it's lovely that we have, you know, so many people on here, but it takes all of us speaking talking about it and sharing the word around the role of nutrition. And then just lastly, every case is an individual, because like we heard from Michael, you know, his sickle presentation was very different. And so we have to take each patient on a case-by-case basis. The next slide, please. So the research impact, this is just the last few slides I want to share with you. The next slide, please. So my call to action, so yes, I was called to action way back, you know, for sickle cell, but then for nutrition in sickle cell in 2014. And part of that was to write those articles, to write the publications, to write the nutrition standards, to ask for the nutrition standards to be included in the clinical standards for sickle cell patients. The doctorate, you know, self-funding the doctorate has not been easy, as Dr. Jenny said. You know, it's been really difficult to self-fund the doctorate because, you know, there was no interest and so forth, but I've done it, and I'm doing it now. And then obviously in terms of influencing policy and practice change, and then this conference, thanks to Susie and Full Circle Fund, you know, this conference, you know, is my call to action. I'm doing this, you know, because I feel so passionate about this. Oh gosh, I could, yeah. And so that was my call to action. As you can see, some of the articles, and I mentioned earlier on my first article that I wrote on nutrition in sickle cell made the front cover of the Dietetics Today, and so yes, I'm really pleased about that. The next slide, please. So the research, the reason why I put this on here is just to demonstrate that I know I've been talking a lot about the research, but it's just to demonstrate, you know, that it has been a journey of co-development. It has been about forming a nutrition alliance between the sickle cell service users, the carers, and the providers and the stakeholders as part of my research project to produce a whole systems management strategy to support the integration of nutrition into sickle cell, and to produce what eventually will be made available to you as the Sickle Cell Nutrition Health Education Framework. And as part of that, I will include a nutrition management toolkit, which includes a nutrition management operational plan, a management prompt sheet, a sickle cell nutrition fact sheet, as well as a tailored Eat Well guide. The next slide, please. And then a call to action. It started with a call to action and it will end with a call to action. So the next steps for each one of us, you know, on the call, and those that will listen to the conference, you know, tomorrow and the days to come, the next steps for me is, and in conclusion, is, you know, that we all need to take a new perspective of how we choose to understand nutrition in sickle cell. That nutrition in sickle cell needs to be mandated as a priority as part of the management, the standard management of sickle cell patients. That we need to adopt nutrition as a management option in sickle cell. That we need to listen to and engage the sickle cell patient voice to influence the change and changing the nutrition landscape in sickle cell. And that we need to apply the nutrition standards to policy and practice, and not just have it as standards that's been done, but actually use that to change the nutrition landscape. And then from a policy and a practice perspective, you know, we need to involve all the key strategic stakeholders. All of us have a role to play. We need to, you know, levy and advocate and reach out and call on the Sickle Cell Society to do all that they can to promote and support the development and integration of nutrition into Sickle Cell Society. The same with the All-Party Parliamentary Group for Sickle Cell and Thalassemia, the UK Forum, Specialist Commissioning, the British Dietetic Association, the BDA, and also primary care. We all need to work together to inform and policy and practice development if we are going to see a change in the nutrition landscape in sickle cell. The next slide, please. So that concludes talk 3, and it brings up the third and the final Q&A session. So Rachel, yeah, if you can. Not Rachel, sorry, Rebecca. Rebecca, come in at this point.
Yeah, so there's lots of people asking kind of specific questions around what would you advise to eat, or is there anything that you would advise to steer clear on? I'm not sure if that's something you want to.
Yeah, I mean, I think what I would say to that is, you know, I had the slide about the Eat Well guide. So that is sort of a pictorial representation of the different food groups that we should be eating. And that's the basis for anybody for good health. But in terms of sickle cell, the key points that I've highlighted, you know, for us to take away with us is the understanding of the anemia that's associated with sickle cell and the inflammation that's associated with sickle cell. And if I can just speak to those two, and then the immunity, you know, the infection risk for sickle cell patients. I'll just speak briefly to those three things, just in with regards to time, but also, so yeah, if I speak about the immunity side of things, you know, I've mentioned on the slide there specifically including the food groups, specifically your fruits and your vegetables, because those foods, your green leafy vegetables and the range of fruits and vegetables that come under that group, because it will provide you with the antioxidants, the vitamins A, the C and the E that are key antioxidants that we need to boost and to counteract that oxidative stress that I've mentioned about earlier on. So definitely just from yes, this is a little bit general, but you know, if you can start there, because I know that from speaking to many sickle patients, they don't do that. So the 5 a day, if you can start with the 5 a day as a way of including those foods that will actually provide you with the natural antioxidants to boost your immune system, you know, that is already a step in the right direction for people who are not doing that. If I can speak,
Claudine, can I just interrupt you, because there's a question specifically about the 5 a day, so it's great timing actually.
Yeah.
Someone was saying that, you know, 5 a day can sometimes be a bit daunting, a bit challenging, and what they tend to do is mix smoothies, but they're a little bit concerned about if that's okay, or if that's helpful, or if that has a link to diabetes in the future at all. So that's you're touching
great
on
question. Great question, because that's bringing a lot of sort of different aspects into the conversation. So there is a role and there's a place for smoothies, and what I want to say right now is that's where the benefit of having a dietitian to hand, because as soon as she said that and asking the other questions related to that, I'm thinking, who is this person? You know, what is going on for her? What's the nutritional status? Is she overweight? Is she underweight? What other medical conditions is going on there for? Because that will inform as to how much of a smoothie, what quantity of smoothie. Do you have 1 smoothie? Do you have 3 smoothies? Because smoothies is a great way that you can actually, for those people, because some people don't like it, they don't like to eat the fresh fruit, they don't like to eat the vegetables, but smoothies is a great way to actually blend that, and a great way to get and achieve your 5 a day. But to remember that with smoothies, it's concentrated, and so 150 ml is sort of the standard portion size for that will count as a 5 a day. So depending on if you are someone who has a low weight, for argument's sake, I would say you can incorporate, you know, smoothies, you can have a bigger portion of that, because that's great to, you know, include the nutrients from the fruits and vegetables. But if you are somebody who's aware of your weight and you're mindful, you know, then thinking about, okay, 150 ml is a portion, is one of my 5 a day. How do I manage that and balance that out with the other things that I know that I need to include in my diet? So nutritional assessment can actually help with that. But great question.
So you were going to talk about something else, unless you want me to ask another question. We've got a few.
Yeah, you can. Yeah. Was there any? Sorry, my brain. I've spoken so much.
That's all right. I interrupted your flow, so don't worry. There's some questions around.
Oh yes, I just remembered inflammation. But let's hear the question, and maybe, because there's maybe people with other specific questions, and let's do that, and then I can come back to the inflammation side of things.
There was some questions around inflammation, but also different types of diets, which it sounds like people have heard about. So FODMAP diet, or a high protein, low calorie, low carbohydrate diet, and the usefulness of those sorts of diets as well.
And again, that brings into the equation the value of having a dietitian to hand, because again, with that, I'm going to ask what is happening for this person. Why are you needing to do that? Do you have any other underlying conditions? And certainly, you know, in terms of diabetes, you know, we've just heard that a low carbohydrate has been proven to have benefits for patients diabetic patients in terms of their glycemic control, but also in terms of their weight loss. So that is there. But it does mean you need to know what else is going on for the person. Are they doing it because, you know, they want to lose weight? Or are they doing it because they want to improve on their overall intake? You know, what is the reason why you're going down that route? Because there's a lot of information in terms of the FODMAP. So the FODMAP, again, is a treatment. And again, this is my area of speciality, but the FODMAP diet is specifically to treat patients with IBS symptoms. So it just, initially there's a range of foods that contains, it's about fermentable oligosaccharides, monosaccharides and disaccharide foods that can actually cause symptoms like bloating and pain for patients, susceptible patients, and cause a lot of discomfort for them. And so with the FODMAP diet, they identify those foods in your diet and you eliminate those foods. And then there's a period where you stay off it, and then there's a period of gradually reintroducing that food. So again, what is the problem for this patient? Why do they think they need to have a FODMAP diet? Have they been diagnosed with anything specific? And that is where, you know, the benefit of having a skilled and a trained dietitian come on board to be able to manage those questions, because they may not need to be on a FODMAP diet, or they may need to be on that, or there may be an alternative that the dietitian can recommend to treat the condition or manage the symptoms that they have. So yeah.
There's some questions about as well iron overload, and how do you consider iron content in food, or is that something that you don't need to worry about because of chelation medication?
Iron overload is a tricky one, because if you understand how iron is metabolized in the body, and it's, you know, there's very little sort of excretion of iron in the body, and that's why you've got this iron overload happening, particularly for patients who are on sort of long-term blood transfusions. And so there's this build up of iron in the tissues, particularly in the liver and in the heart. And so it's sort of balancing out, you know, in terms of, do I eat more iron because, you know, or do I cut out iron because I've got iron overloading, knowing that that iron actually gets stored in the cells rather than is available in the plasma, if you know what I mean. And so it's having a conversation, it's looking at the patient's bloods, you know, in terms of their ferritin levels as well. That will give an indication. There's things like transferritin levels as well that you need to look at. And so I would say for that person, you know, speak to your consultant, your clinician, and have a look at your blood levels for that. And also then look at what types of foods are you normally having. Are you having foods that contains heme iron? So that's predominantly iron that is more bioavailable and comes from your animal products. You know, if you're having a lot of that, you know, or maybe you're getting iron from plant sources instead of you know, your animal products. So again, it's about having that information around to be able to make an informed decision as to what is the best way forward for this patient. You know, the recommendation out there for sickle patients is to stay away from iron, but we know we've got this whole idea of this rapid breakdown of red blood cells and new red blood cells having to be produced, and iron is a really important mineral in that process. So do we exclude the iron, which has a knock-on effect on our ability to make new red blood cells? And so that conversation needs to be had. And all these questions just highlight the value again of having a skilled and a trained dietitian to be able to, you know, do those nutritional assessments, bearing in mind all of those factors, which unfortunately isn't available to many sickle cell patients. But yeah, so the whole idea of iron overload is a tricky one. You have to know what your blood levels are for ferritin, transferritin, look at your diet, and then you can decide, you know, do you need to have a little bit less of the foods that contains more iron, and how do you balance that out in your normal diet?
that's really helpful. Thank you. We've got some questions about your research, but just before I come on to those, there's been a few people saying they've recently had babies or have got kind of young toddlers, and in that kind of weaning phase, and how you can kind of support babies and young toddlers with nutrition as well. I'm not sure if there's anything.
Yeah, so pediatrics is not my area of speciality, but Chloe, one of the pediatric dietitians that I worked with, and she was actually a participant on my research. So she's actually put together a leaflet with my support around nutrition in sickle, particularly for the pediatrics, the younger children. I think with for young children, you know, healthy eating, you know, following those basic principles is a good starting point. But depending on the symptoms that your child has, and what's come through again from the feedback from the research from Chloe specifically being a pediatric dietitian, is the fussy eating. A lot of the sickle patients that she interacts with, the little ones, they can be fussy eaters. You know, they don't like fruits and vegetables, and they only like to eat a specific thing. So again, it is sort of, you know, you want to go in with a balanced approach in terms of the nutrient side of things, but you also want to be aware what, you know, is there a specific problem in terms of your child being a fussy eater, or is there a certain problem in terms of your child not wanting to eat a specific food, and then having the guidance hopefully of a dietitian that can actually support that the weaning process, particularly if it's a much younger child, the weaning process. Because that's available to other patients and other children, so why not sickle cell patients? And again, that the clinician plays an important role there. If if your child is under a clinician consultant, and that is the question that you have, you know, getting them to refer that child onto seeing a pediatric dietitian, you know, in the first instance, that is a way, and that's part of using your voice, and it's part of asking for the services that you need, you know. And so for that mom, I would say, you know, go back to your consultant or your clinician who's supporting you, and get them to refer your child to a dietitian that can give you guidance around it. But just generally speaking, it will be that healthy eating sort of as a basis. And then depending on what else is going on, depending on the blood results, you know, and the frequency of crises or, you know, other symptoms, then those adjustments will and can be made with the nutrients and the types of foods and the amount of foods that your child needs.
Just aware of the time, I'm going to squeeze in one more question, if that's okay. This might have to be the last one, but when some people are asking when your guidance surrounding kind of sickle cell and when your standards, when are they going to be published, and how will people be able to get hold of your PhD when it's published?
Yeah, so the standards are actually available. They're on page 76 of the current nutrition standards that's available on the Sickle Cell Society website. And I've also just written an article, because what I recognized was, and as part of my research, that the participants didn't know about the standards. And so, you know, so what's the point of having standards when no one knows about it? And so that's why I wrote an article about the standards, which was published in a national magazine just in February of this year. And for those people, they can reach out to me, and I'm more than happy to share the link to that. But you can actually find it on page 76 of the National Clinical Standards for the clinical management of sickle cell patients on the Sickle Cell Society website. So that's there. I'm in my 5th year of my research now. I'm writing up my thesis. I'm hoping to submit sometime next year. And so hopefully sort of the latter part of next year, I'll be able to share the Sickle Cell Nutrition Health Education Framework, because I do believe that is a very, very key tool. As I said, that, you know, my hope is that it can support the integration of nutrition in sickle cell, but it can also, you know, be an educational tool for service users, service providers, stakeholders, clinicians, etc., etc. So hopefully, all going well, I will be able to share that with you towards the end of next year.
That sounds absolutely fantastic. I think we'll leave the questions there. I'm going to invite Susie to come back onto screen as well.
Thank you.
Hi there. Hi. Gosh, Claudine and Rebecca, thank you so much to you both. That was just absolutely riveting. You are quite clearly, Claudine, a one-woman tour de force on the subject. I knew it from the moment we first spoke. We scheduled a 30-minute call, and I think it was an hour and a half, possibly more after, and we could have said so much more. I'm absolutely thrilled to have heard this. I know we're going to do the poll, I think. Probably, Rebecca, you're going to just pull in something from the poll just before we sign off. So that's great. If everyone would be able to just complete the closing poll, that would be absolutely fantastic. Really, I just want to use this time really just to thank everyone who has been involved in making this happen. I wrote down at one point, a journey of 1,000 miles starts with one step. And I feel that that's so important. What I loved about all that you have said, I love so much about it, but what I loved about it is your ability to help us all in whatever way we believe that this is important, to be self-empowered, to take the step that we can take, whether someone is a patient, whether they're a carer, whether they are a dietetic student at university, whether you're a university course director, whether you are a doctor, nurse, student nurse, psychologist. This is a subject that no one should be missing out on. And what I also want to reassure those that are asking is this whole recording from start to finish is going to be on our website. It's going to be center stage. It's a resource. We want you guys to have it as a resource. Whatever is your interest in this, this is for you. This is if you like a call to arms. It's a call to, it's in your hands. And I'd just like to take a moment just to thank everyone who has really been a part of this. I really want to thank, first of all, Dr. Jenny Darquois for being with us today. Michael Siagbe and Regina Siagbe for your incredibly important contribution. The lived experience, which has opened up other questions, and I think we'll talk together about maybe getting those experts in that lane to maybe bring, be a part of this. To Dr. Rebecca Easton, obviously you've done an amazing job fielding those brilliant questions that have been coming in from everyone as they've been coming in thick and fast. To Dr. Lizzie Rose for contributing at the beginning. I also really must say to the brilliant team behind the scenes who got on board the moment I asked them, which is the team at Chamberlain Dunn, who have put this on. I didn't know how to put an event on a couple of months ago, and probably still don't really, but with amazing people, it's amazing. You put it out there, you start taking a step, people join you. And this day is testament to that. So I really want to send a special shout out, please, to Rachel Fisher, who's been behind the scenes doing an amazing job, Alison Dunn and Will Chamberlain-Webber, all have made this come together with us. Last but not least, from my side, has been part of a very small charity, but with a very big vision that believes in you, the individual hearing this. We believe in you. We put a call out and at the beginning of the COVID pandemic to those funders that could help us change our ability to reach patients far and wide across this country. I must say, the National Lottery COVID Response, Emergency COVID Response Fund said yes, and they got behind us, and the Rousing Trust got behind us. A lot of trusts, no, overwhelmed, whatever. It's hard work, as probably some of you know, raising money, but those two got behind us that enabled us to begin properly talking to patients. I must say a thank you to Jose and Mimi, the first patients, sickle cell, that we spoke to, who said, we need this, and they'll be hearing this, and I need them to know, and others to know, ask, this is your time. And it's never been more needed, and the time really is now. So I think there is so much wealth of information, guidance. Claudine and I will talk more. I picked up obviously that we will talk to some with Claudine, some experts. The Eat Well guide, we'll see maybe if we're able to get that up on our website. We'll look at all your questions, and once Claudine has sort of been able to relax after all of this, so next week we will try to put them together in a Word document so that they become a Q&A, with the A's coming from obviously Claudine and guidance from her. That's it. I know that Rebecca, you want to give us some feedback on the poll, and I don't know if you're me.
I am sorry, I just lost you for a little bit, so I wasn't sure if it was my connection or not. Joys of working virtually, isn't it? Thank you so much for everyone that's answered the polls. That's been really helpful for us, and it's one of the things we really wanted to measure how helpful this conference has been, because it's one of the ways that we can then say, okay, well, let's do it again. Let's think about what other information we can draw together for you and get out there. So just looking at the polls, perhaps there's something that we'll put on the website as well. But a lot of people found today really helpful. So big hat off to you, Claudine, some really useful information there. And just from eyeballing them quickly, I'm glad to see that people's knowledge has improved just from listening to you today, which is really, really fantastic, and also confidence in applying that knowledge as well. So just a quick summary of those polls. Thank you. If you haven't filled them in yet, there's a few more minutes just to be able to click through those answers.
Wonderful. Thank you very much, Rebecca. That's fascinating. It's a great idea when it's all collated. I think that'd be really great to put that on the website. So I think really what I'd like to do is my last thank you is to all of you who have listened to this. We know that right now we've had people from 3 continents, from North America, Europe, obviously Britain and Europe, and Africa as well. I think tomorrow, World Sickle Cell Day, we've got a contingent in Australia who are waiting avidly to listen to it on the website. So just one final word, it will be on our website, which will be www.fullcirclefund.org.uk. So my thank you to everyone who's been listening. And my final thank you has to go to Claudine. Claudine, I really just feel so privileged to have found you, to have met you, to have heard you this afternoon. I'm now going to ask you to say the final words, whatever you want to say to close this fantastic, first of its kind in the world conference on nutrition and sickle cell. Over to you, Claudine.
Thank you, Suzanne. And if I can have the last slide, please, Rachel, as we close. So as Suzanne mentioned, I just want to echo a great big thank you to each and every one of you who have come today, and those of you that will listen later on. But I want to leave you with a quote that I wrote for a book chapter that I wrote recently. And it's, every closed door brings you closer to your destiny. And certainly on this journey, I've had lots and lots of closed doors. But today, the conference for me is the destiny, part of that destiny. And so today I'm grateful for every closed door that has been closed, but it's opened up this opportunity for me to be the keynote speaker at the inaugural Nutrition in Sickle Cell Conference. And so I can't go without thanking and acknowledging Full Circle Fund Therapies. And Susie, thank you so much for giving me this opportunity to speak and to share my passion on this topic. And in the last minute, I want to leave you with my ultimate favorite quote ever. And it's a challenge to you. The 73 of you are still on screen. Is this? It's by Ralph Waldo Emerson, and it reads, "Do not go where the path may lead. Go instead where there is no path, and leave a trail." And this quote sums up my journey on, you know, the road to nutrition in sickle cell. There wasn't a path. There wasn't a path. But today, I'm really thankful that I have been able to forge a new path and leave a new trail with so many of you on board, continuing that trail. So thank you from the bottom of my heart. Thank you.